Okay, live stream is up. PC recording done.
Cloud recording is on the way.
Thank you. Good afternoon, everyone. Welcome to today's remote New York City Council fiscal 2023 preliminary budget hearing of the Committee on Immigration. At this time, would all panelists please turn on your videos? To minimize disruption, please place electronic devices to vibrate or silent. If you wish to submit testimony, you may send it to testimony@council.nyc.gov. Again, that's testimony@council.nyc.gov. Thank you for your cooperation. Chair Hanif, we are ready to begin.
Thank you. Good afternoon, everyone. I'm Councilmember Shahana Hanif, and I'm the chair of the Committee on Immigration. At my first hearing a couple weeks ago, I had shared with you all that I just had a left hip replacement done. I am recovering really well, and I'm excited that I'll be fully on video at this hearing. And thank you all for being super, super graceful and gracious with me in sending prayers and thoughts. I'm really excited to be the chair of this committee and especially looking forward to today's budget hearing. Today, the committee will conduct a hearing on the fiscal 2023 preliminary budget and how it addresses the needs of our immigrant New Yorkers and how it prioritizes services for immigrants, especially in this critical time of COVID recovery. The Mayor's Office of Immigrant Affairs fiscal 2023 budget totals $817,000 and supports 7 positions. However, this budget doesn't provide a full picture of MOIA's budget. In fact, the office coordinates and collaborates with various city agencies, including the Department of Youth Services, the Human Resources Administration, the Department of Education, New York City Health and Hospitals, DOHMH, on managing MOIA programs that are found within these agencies. This budget has substantially reduced funding for the adult literacy programs. Literacy programs are essential to navigating healthcare, education, access to better jobs, and participating in the city's recovery effort. And I'll also include, as I've heard from adult literacy providers, these have been spaces to articulate and support needs of Asian immigrants in the wake of increased anti-Asian violence. So the cut is a massive disappointment and a move toward a disinvestment that will absolutely harm our immigrant communities. This committee is interested in hearing how the administration plans to prioritize critical services for immigrant New Yorkers and their families. The budget must adequately address these concerns and take into account the needs of all immigrants. The committee is calling on the administration to restore funding for immigrant services and to expand adult literacy initiatives. Over the last 2 years, our city has seen a spike in anti-Asian violence and hate crimes, and we all must do our part to call it out and stop it. We want to ensure that MOIA is utilizing all resources available to inform Asian immigrants about mental health services. This also includes community-centered approaches to destigmatizing receiving mental health services. I want to emphasize the need for adequate funding levels for services because this is about the sustainability of services for immigrant New Yorkers. This is essential for tackling inequality and building stability and safety for immigrant families that are facing uncertainties every single day. The investments we put forth affirm that our city is a sanctuary city. I'm looking forward to hearing from the administration on their strategy and budget plan and how they'll be engaging with agencies to best serve immigrants. After we hear from MOIA, the committee will hear testimonies from the public. Lastly, I would like to thank the speaker and the mayor in supporting the needs of our immigrant community. I also want to make sure that we thank our committee staff for their hard work, Unit Head Krillian Francisco, Financial Assistant Analyst Florentine Cabore, Committee Counsel Harbani Ahuja, Data Analyst Ben Witt, and my Legislative and Budget Director, Alexander Liao. Now, I would like to welcome the Commissioner of the Mayor's Office of Immigrant Affairs, Manny Castro. I'd also like to recognize my colleagues who have joined me today. I see Councilmember Ung, Councilmember Moya, and nobody else at this time, but I'll continue to give shout outs. And before we hear from you, the committee council will swear you in.
Thank you, Chair. I'd like to just recognize that we've also been joined by Councilmember Sanchez and Councilmember Joseph. My name is Rabani Ahuja, and I'll be moderating today's hearing. Before we begin, I want to just remind everyone that you will be on mute until you are called on to speak, at which time you will be unmuted by the host. If you mute yourself after you've been unmuted, you will have to be unmuted again. So just please thank you in advance for your patience. There may be a few seconds of delay in the process of muting and unmuting. The order of today's testimony will be as follows. The first panel will be the Mayor's Office of Immigrant Affairs, followed by council member questions, and then members of the public will testify. We do have several folks signed up to testify today, and we thank everyone for joining us, and we will get to everyone today, so thank you in advance for your patience. During the hearing, if council members would like to ask questions, please use the Zoom raise hand function, and you will be called on in the order in which you've raised your hands. We'll be limiting council member questions to 5 minutes, including responses. I will now call on Moya witnesses to testify, including those available for question and answer. Testimony will be provided by Manuel Castro, Commissioner of the Mayor's Office of Immigrant Affairs, and additionally, the following representatives will be available for Q&A. Ann Montesano, Executive Director of Interagency Initiatives and Language Access at the Mayor's Office of Immigrant Affairs, and Tom Twitterici, Director of Legal Initiatives at the Mayor's Office of Immigrant Affairs. I will administer the oath and call on each panelist individually for a response. Please raise your right hands. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions? Commissioner Castro?
Yes.
Thank you. Ann Montesano?
Yes.
Thank you. Tom Twitterici?
Yes.
Thank you. Commissioner, you may begin your testimony when you're ready.
Thank you so much. And thank you, Chair Hanif and the Committee on Immigration for holding this budget hearing. And of course, thanks to all the City Council staff and all the admin staff for your work in preparation for this hearing, and all the community organizations that are going to be testifying today. My name is Manuel Castro, and I am the Commissioner of the Mayor's Office of Immigrant Affairs. I want to first start by highlighting some of Moya's mission as outlined in the charter. I think it's important to just review and then go into our work and some of the challenges that our community has been facing. First, the charter explicitly notes that immigrant New Yorkers make up a large percentage of the city's total population. That is about 3 million New Yorkers, or almost 40% of the population is immigrant, and 60% of all New Yorkers are either immigrants and children of immigrants. So because of this, the well-being of the city depends on the willingness of immigrant New Yorkers to engage with city government. Given this reality, Moya is not and cannot be the only office that seeks to serve our immigrant communities. So all agencies must think about the needs of immigrants when engaging in their work. And that is a critical role that all agencies must play here in New York City. The charter recognizes that Moya's unique expertise as the mayor's office that focuses on immigrant-related issues and requires our agency, our office, to advise and assist the mayor, council, and other agencies on developing and implementing of policies related to immigrant and limited English proficiency New Yorkers. Track state and federal policy and law, increase access to city programs, benefits, and services throughout outreach, and help advise on the legal services needs of immigrants. Moya is also required to consult with the community and other stakeholders and coordinate an interagency task force on immigrant affairs. In addition, Moya works with relevant city agencies to address the needs of immigrant crime victims and witnesses, including by working with agencies on the issuance of U visa certifications and T visa declarations. And finally, Moya is also required to report annually on its programming and on the demographics and needs of immigrant New Yorkers, a report we will be issuing this week. I am proud to say that Moya does this and much more than the charter mandates, and I am excited to speak of some of our work today. This testimony will briefly outline the challenges that immigrants face and highlight some of Moya's work in the past fiscal year. So first, challenges during the recovery, that is the COVID-19 recovery. Over the past year, we have seen hopeful changes in the landscape of the global pandemic. Vaccination rates have increased, positivity rates have gone down, and the city has begun to reopen. As the city begins to shift towards normalcy, though, it is crucial that this recovery process is equitable and that we do not leave our vulnerable communities behind. Moya's in-house research department has previously published an analysis on the disproportionate effect of the COVID-19 crisis on immigrant communities. Immigrants have been a key part of the story of the city's recovery, including by serving as essential workers. Half of the 1 million essential workers serving on the front lines are immigrants. But despite this service, immigrant New Yorkers still face numerous barriers that must be addressed. As just some examples, and as our previous annual report have consistently noted, immigrant New Yorkers earn less, are more likely to be uninsured, live in overcrowded households at greater rates, and are more often rent burdened, and have higher rates of poverty than their native-born counterparts. In addition, many federal and state policies and programs fail to take needs of immigrants into account. Over the past year, however, we have seen heartening changes at the federal and state level. The Biden administration continues to emphasize the need for a path to citizenship for many undocumented immigrants, and the state has implemented key programs to help address fiscal and other needs of immigrants. I look forward to additional partnership in the year to come, especially with the federal government, as they look to implement or to pass comprehensive immigration reform. So next, I'd like to provide an overview of our FY 2020 activities. I want to emphasize, however, that I am not covering all of Moya's work in this testimony. The annual report will include description of ways that Moya designs, proposes, and implements, and ultimately manages a portfolio of programs that directly serve immigrants and are intentionally responsive to their needs. And I urge the committee and others on this hearing to review that report when it is released very, very soon. The following overview touches on just a few relevant pieces of our work, which focuses on two main areas: responding to the unique needs of our immigrant communities and closing the access gap for immigrant New Yorkers. So first, responding to the COVID-19. To address the disparate impact of the pandemic on immigrant New Yorkers, Moya partnered with private funders, city agencies, and community-based organizations to implement emergency relief programs, including NYC COVID-19 Immigrant Emergency Relief Fund and the creation of the Mayor's Fund COVID-19 Immigrant Burial Assistance Program. Moya also connected immigrants in need to community-based organizations who assisted individuals in applying for new state programs like the Excluded Workers Fund, Emergency Rental Assistance Program, and the New York State Homeowners Assistance Program. Moya also independently screened constituents and connected them to the housing resources available through FASTN, Funds and Services for Tenants Experiencing Need. Another piece of Moya's role in addressing the COVID-19 crisis, is connecting New Yorkers to vaccines. Many of Moya's teams work closely with the Vaccine Command Center on vaccine outreach and distribution, with a special focus on reaching New York City's immigrant communities. Over the past year, Moya partnered with the VCC and NYC Health and hospitals to secure $2 million in funding for a vaccine outreach program targeting undocumented New Yorkers, contracting with 15 trusted community-based organizations to reach undocumented communities and provide direct assistance in accessing COVID-19 vaccines. In addition, our language access team worked to ensure that language access was not a barrier to information or services by advising and providing technical assistance to agencies and by delivering critical translation and interpretation support where necessary. This included the delivery of over 1,000 translations into 22 languages for the VCC to support community vaccination efforts. Our team also conducted extensive outreach, helped facilitate appointments for vaccines, and held town halls and virtual events on multiple platforms and in 13 languages. The outreach and organizing team also supported the VCC in launching the NYC Vaccine Mobile Clinic program. Additionally, Moya shifted our programming as the city's response to the pandemic entered a new phase. The IDNYC program, which was funded for over $15 million in FY 2020, closed its enrollment centers in 2020, while simultaneously ensuring that cardholders and applicants could still access services and benefits. In 2021, IDNYC reopened enrollment sites in all 5 boroughs and responded to public demand by increasing capacity overall throughout its enrollment sites. Moya also continues to manage the outreach for NYC Care, which guarantees low and no-cost healthcare services to New Yorkers who do not qualify for or cannot afford health insurance. In the first year of the pandemic, the program worked to support these communities by expediting the rollout of the program to ensure all eligible New Yorkers had access to the program. As the pandemic continued into 2021, the program adjusted again to respond to the growing CBO and community need for support by issuing a new RFP that increased contract timelines to 1 year, allocated additional funding to support direct enrollment by CBOs, and allocated additional funding for casework. In calendar 2021, NYC Care Outreach CBO partners reached approximately 285,000 New Yorkers who speak more than 40 languages other than English across the 5 boroughs. When it comes to legal services, New York City has invested tens of millions of dollars into immigration legal services, recognizing that immigration legal services are a tool of empowerment for immigrant New Yorkers and their families. Legal services can help immigrant New Yorkers stabilize their immigration status and access jobs, health insurance, and education, ultimately benefiting New York City as a whole. So Moya's legal services programs exist in partnership with legal service providers, community-based organizations, and city agencies, and include Action NYC, NY Citizenship, the Rapid Response Collaborative, a new program that addresses emerging needs in the past fiscal year. In total, Moya oversees more than $10 million in funding for legal services programming, over $8 million of which is baselined. Action NYC makes up the lion's share of that funding, with over $8.7 million allocated to that program. Action NYC and RLC providers conducted over 11,000 legal screenings in 2021, a 30% increase from 2020, and opened over 6,100 new cases, an increase of 21%. So turning over to language access in language justice and English language learning. The Mayor Adams administration is committed to language access. This is a large task. About 22% of New Yorkers have limited English proficiency, and about half of immigrant New Yorkers have LEP. In addition, over 200 languages are spoken in the city. This linguistic landscape presents complex challenges for all city government, While the city has made progress on ensuring that all New Yorkers can connect with the services and programming they need, regardless of what language they speak, there is much left to do. Moya plays several roles in advancing language justice. First, Moya conducts multilingual outreach and provides multilingual information to immigrant New Yorkers. This includes providing interpretation and translation services to mayoral offices. In 2021 alone, Moya's language services team delivered 2,850 translations of 937 different source documents in 47 different languages. Let me repeat that. In 2021 alone, Moya's language services team delivered 2,850 translations of 937 different source documents in 47 different languages alone. Second, Moya helps to strengthen the city's capacity to communicate effectively with New Yorkers with LEP by advising and providing technical assistance to over 30 agencies and 20 mayoral offices, as well as external entities. This includes advising on language services procurement, providing guidance on creating multilingual websites, sharing practices on multilingual outreach and engagement, and advising agencies on and conducting oversight of implementation of Local Law 30. And third, Moya serves as an experimental lab to pilot language access best practices and educate partners on those practices. For example, Moya piloted contracting with a technology vendor to human translate our website into 10 local law 30 languages instead of relying on the standard machine translation. Moya shared its work on creating multilingual websites with other agencies, and as a result, some of these agencies have persuaded similar strategies. Other programming within the office also touches on the needs of New Yorkers with LEPs. In 2021, Moya continues to develop and administer We Speak New York, the city's free language English language learning program, which was funded at $1 million in FY22. We Speak New York launched 2 PSAs and a new Shola's Voice episode in 2021 in collaboration with Democracy NY and CUNY. These new productions emphasize the importance of voting among NYC's diverse immigrant communities and communicated the steps to participate in the city's new ranked choice voting process, which was administered during NYC primary elections. Shola's Voice also addressed the importance of immigrant communities engaging in the democratic process and explored how an individual's voice is heard by voting. Moving on to addressing emerging needs. The COVID-19 pandemic was not the only emergency that faced our immigrant communities over the past fiscal year. Moya shared its expertise when the city responded to emergency needs by providing language access support to emergencies, as it did to the fire in the Bronx most recently, and last year during the Hurricane Ida, and in response to the COVID-19 pandemic. In addition, Moya advised on a new programming in the wake of several emergencies. This included helping advise on the joint city and state program to provide relief for survivors of Hurricane Ida who could not access FEMA funding. The city and state allocated $27 million to provide relief for undocumented New Yorkers who did not qualify for assistance through FEMA. While the state operates this program, Moya meets regularly with the providers and the state and track questions and advocates with DOS, Department of State, when appropriate. Moya met with the Department of State multiple times to advocate for changes to the fund as implementation proceeded. As another example, Moya worked to secure $1.5 million in new FY22 funding for community-based partners, providing linguistically and culturally responsive case management and immigration legal services for newly arrived Haitian immigrants. These new arrivals came into New York City due to the recent natural disasters, political upheaval in Haiti, and changes in federal policy. This funding supports case managers who work with newly arrived immigrants to determine eligibility for benefits and connect them to resources and services, and also funds legal services for assistance in applying for immigration relief. Finally, in response to global events such as the Afghanistan evacuation and Ukrainian invasion, Moya takes a primary role in assessing the local community needs that result in how the city can help address them. For example, we have created web pages and resources for impacted communities and those seeking help, translated into relevant languages. Moya continues to monitor the situation in Ukraine and work to respond to the crisis there and its impacts on our communities here. On March 1st, in a joint statement, the mayor and myself asked the Biden administration to consider the use of every tool at their disposal to address the crisis. The Department of Homeland Security subsequently designated Ukraine for TPS for 18 months. Moya will continue to work to partner closely with community-based organizations, immigration legal service providers, community-rooted volunteer and professional groups, and educational and cultural institutions to provide additional legal assistance and support as needed. I would also like to talk about our empowerment and advocacy, which is a very important component of Moya. Moya is mandated to conduct outreach to immigrant New Yorkers to facilitate access to city resources and services. The organizing and outreach teams play a critical role in closing the gap in access for immigrant New Yorkers by helping secure emergency food, PPE, at-home COVID-19 testing kits, information on ranked choice voting, and by sharing information on many more topics. In 2021, the organizing and outreach team held 299 in-person events, again, 299 in-person events, including resource fairs, tabling, Know Your Rights presentations, and canvassing, reaching over 83,000 community members across the 5 boroughs. Through over 250 virtual events, the organizing and outreach team reached an additional 36,000 community members. In addition to our charter-mandated responsibility to conduct outreach, Moya also works to empower the community to exercise their rights and access key services. Moya conducts Know Your Rights presentations across immigrant communities and partners, covering different topics and utilizing different models to deliver critical information. In 2021, Moya conducted over 600 forums, engaged in over 17,000 attendees, and reached over 40,000 live views. The community services team also connects immigrant New Yorkers to the help that they need by offering a real-time support system through in-person public-facing events, convenings with key stakeholders, and the Ask Moya hotline. In 2021 alone, the Ask Moya hotline shifted to in-depth case management and follow-up to ensure that New Yorkers are accessing the services they are entitled to. In 2021, the Ask Moya hotline and email inbox responded to over 4,300 calls and 160 emails and made 960 referrals. And finally, addressing the issues that immigrant New Yorkers face requires engaging with all levels of government. In 2021, Moya worked to coordinate local, state, and national advocacy on behalf of immigrant New Yorkers, including by partnering with local elected leaders across the nation to push for federal changes, and by submitting comments, supporting legislation, and connecting with state and federal partners on a variety of topics. I want to especially highlight the work we do with Cities for Action, a coalition of over 170 US cities and local governments that collectively advocate for pro-immigrant federal policies and exchange best practices on local policies and programs. As one of the founding cities of that coalition, over the past year, we have shared toolkits on citizenship for essential workers, TPS advocacy that outlines on the state of play advocacy talking points in social media messaging. The coalition has also issued multiple statements and sign-on letters calling for more TPS designations and pushing for relief for Haitian and Afghan immigrants, held special topics calls and equitable vaccine distribution and more, and hosted an annual convening for our partners from across the country. And so just to conclude, I want to thank everyone again for being on this call and for your participation in this hearing. I look forward to working with council on addressing the urgent needs as the budget process continues. And I'll be happy to answer any questions that you may have. Thank you so much.
Thank you so much, Commissioner, for your testimony. I'm going to now turn it to Chair Hanif for questions. If folks from the administration could stay unmuted during the question answer period, that would be helpful. Thank you.
Yes.
Thank you so much. Thank you, Commissioner Castro, for a very comprehensive overview of the agency. I'm also really excited about the release of the report. It's so critical that Moya share this information in writing to the public and to really see how we're doing year to year. And I'm just excited to delve into and dive deep into what you've already shared out with us to better understand Moya's workings day to day. So to begin, as we enter fiscal 2023, what budget recommendations has Moya provided to the administration related to immigrant issues?
Thank you, Chair Hanif. And, I wanted to provide as much information as possible in my testimony. I hope I wasn't too long, but I will definitely provide as much as we can in the report so that yourself and the public are fully aware of what we do at Moya and to work together on these many issues. In terms of the question, I've immediately began to work at looking through our programs and initiatives, and I've emphasized to my colleagues in the administration how important our work is, not just the work that we do here, but the work that we do across for New Yorkers and across the city, and the work that other sister agencies do with immigrant communities. In the last couple of weeks, I've been in the post for eight or 9 weeks now. I've proposed a number of initiatives to the team here, emphasizing language access, because for me, and I know the team here, language access and language justice is key to bridging the gap that exists between immigrant communities and city services. And that is something that is a priority for me, as I've shared many times, and also proposing or working on proposals that we continue to develop to addressing the crises at hand, whether it's the conflict in the Ukrainian region or anything that might come up in the near future.
So aside from supporting refugees and ensuring language access, are there any other recommendations that you are proposing?
Mm-hmm. I think we're going to be, we're going to have a chance to propose additional programs and services and new needs in the next couple of months. And I'm just excited to be able to work on those for our team here and working collaboratively with you and the council on these proposals.
Good to know. I have a separate section on language access, and so we will delve into that in a little bit. But to continue on the budget priorities, were there any new needs, and perhaps serving our refugee communities is one of them, any new needs that Moya has asked from OMB but did not receive funding in the preliminary budget?
Well, no, not as of yet. We're working on a number of proposals, but not as of yet. We have not been denied any of the funding because we haven't proposed any yet, but we're certainly looking at many different issues that might require additional support.
Understood. And when do you think the proposals will be shared out?
I believe there's a timeline, but I think they, as needed, we are able to propose back to our colleagues at OMB and to the administration.
Understood. And I'd love to be a partner in that work as needed.
Mhm.
The administration has set an additional savings goal of nearly $2 billion, which will be achieved in part by implementing this administration's first program to eliminate the gap. Which city agencies does Moya think the PEG may affect immigrant New Yorkers? HRA, DYCD, could you speak on that?
Well, I think IDNYC is the one that we at least, in my evaluation, I see will be impacted to the most in terms of the programs that we collaborate on. But I certainly will defer to the OMB to be more specific about the PEG across city governments.
Understood. And then has Moya provided any feedback or recommendations on programs not to be impacted in fiscal 2023?
Well, in terms of programs at Moya,
Correct. Mhm.
well, I've definitely, encouraged them not to, I suppose, I encouraged the team to understand how critical our programs and our work is, which is why the PEC didn't impact us didn't impact us, except for, like I mentioned, IDNYC. As a result, we lost 3 vacancies, but it didn't impact our current staffing or resources.
Understood. Okay. I'd like to move into health and mental health, and at a later portion this afternoon, we will talk about vacancies in the agency.
Mhm.
Given the spike of anti-Asian violence, the immigration enforcement and family separation, and even the experience of moving to a new country, in many ways, immigrants experience mental health issues, including depression, PTSD, substance abuse, anxiety, and much more. How do you engage with immigrants facing mental health issues? Have there been any specific ad campaigns, outreach and engagement tools that the agency is utilizing to inform Asian immigrants about mental health care services?
It's a great question. We do consult, or rather, Department of Health and Mental Hygiene and the Office of Community Mental Health does consult with us on ways to reach the immigrant community, and we have provided assistance with language access in cultural competency work. That's certainly a big issue that we partner on with not just those agencies, but many other agencies. And we're working closely with community-based organizations to also make sure that communities know the resources that exist and that we're able to reach those communities impacted. And from our team, who directs many of our interagency language access work, is on the call too. And if you'd like to add anything to that. Anna, I don't know if you're unmuted. Oh,
Sure. Who did you want to call on? And then we can make sure. Okay.
Ed Montesano, who's on the call with me.
Hi, yes, just to piggyback on what Commissioner Castro was saying, Moya engages pretty regularly with a number of offices that provide mental health services and resources. So we provide interpretation and translation support to the Office of Community Health. We help translate a number of their materials. They had a trauma guide that they translated, a guide for community, faith community leaders, mental health resource guide, LGBTQI mental health guide, and we've been translating these materials. We provide technical assistance to them as well. So recently they reached out and we provided language data to them to help inform their ad campaign. So we are in sort of constant touch with them. as well as the Office to Prevent Hate Crimes on providing this kind of language support.
That's really good to know. And are you also concurrently doing work with our community-based organizations? I was just in a meeting with SUPNA NYC, and they've just put out a really incredible report on the mental health issues of Bangladeshi women in the Bronx and their members. And of course, language access is one big barrier, but another is just views on receiving mental health care services. Even when the materials are translated, the services are available in our languages. Is there any work that Moya is doing with CBOs directly and in tandem, a sort of cultural revolution to destigmatize approaches to receiving mental health care?
You know, I do believe that our organizing and outreach team is in constant communication. We partner with a lot of CBOs across the city, those that we fund and not fund. And that's certainly something that is a priority. It's one of our anchor activities at Moya, and so we certainly want to continue to do that work and grow it. It's really important that we're very much, involved in the day-to-day that community organizations are doing to support their communities. And in particular, this case, I think it's urgent that we do more on it.
Agreed. So now NYC Care, what options exist for mental health services? Are there NYC Care doctors and healthcare professionals screening for mental health needs when they interact with their client population?
Well, I just had held an event, an NYC Care event, with some of our partners at H&H and Department of Health, and I know that there is an attempt to sorry, I think I read too much in my testimony. There is an attempt to reach as many communities as possible and open the doors of our various agencies to communities that are in need. And so the outreach effort, this year is going to be extensive. Of course, we don't have oversight of that, but we do provide the outreach support, particularly when it comes to NYC Care, which we help people enroll in and screen and work with communities, especially in immigrant communities that perhaps the city hasn't been able to reach as much. So that is our focus and emphasis as an office, and we'll continue to do that work and double down on it.
And how has the rollout been of NYC Care so far? And if you can share how many participants have enrolled to this program to date?
Yes, I don't have the specific number, but about 2 weeks ago, we held an event marking the 100,000th enrollee, and that was a very meaningful event because we had participants who had enrolled and had been positively impacted by the program, and I think it's a good sign that there is a desire for this program to continue and grow, and that folks are connected to it. My parents are enrolled in this program, and I know that it's one that we hope that other cities and states can model, because it provides access to health benefits to communities that often don't have them, but in a culturally responsive way and in such way that the services are in their communities. And so I'm really thrilled to continue to work with the team there. And I'm sure that in their testimony, they'll also highlight how we've partnered to making sure that we are reaching immigrant communities. NICE, the agency I used to lead, was one of those agencies that partner closely with NYC Care, in part because of a contract we received from Moya. NYC Care Clinic happened to be around the corner from NICE, and so it's a great model, and I'd like to continue to support it.
That's really great to hear. Do you know the percentage of participants who are limited English proficient?
I don't have that in front of me, but be happy to get it. My assumption is that probably most, because the program is targeted to immigrant communities in neighborhoods that are predominantly immigrant, but I'll have to look at that data.
Just to add a little context and responsive to the question, on behalf of my colleagues in Moya programs, in FY22, NYC Care Outreach reached more than 171,000 people, and NYC Care recently announced that they have that they have 100,000 actively enrolled members, and the outreach for NYC Care was conducted in more than 21 languages. So don't have specific information regarding the language proficiency of individuals targeted, but can say that the program has been responsive to those needs.
Thank you so much, Tom. And then what would you say are the challenges of NYC Care? What can be improved?
It's hard to me to specifically talk about the program since we don't have oversight over it, but I do know that we've reached over 100,000. We'd like to double that, right? And we'd like to support H&H, Department of Health, and everyone involved to make sure that the quality of care continues to be high, and we continue to target immigrant communities, and the services that they're providing are reaching those in most need. But in terms of the program itself, because we don't have oversight, it's hard to say. But we certainly want to continue the program to be strong for the communities that we serve.
Absolutely. And it's really wonderful to hear the numbers that Tom shared. Thank you for sharing that. And I'd like to know a little bit more about the outreach team. How many folks are responsible for reaching our communities? Could you give me some more background on how Moya conducts the outreach?
Okay. Well, the outreach team, sorry about that. Primarily, as I said earlier, works with community-based organizations on the ground. And as I've said before in my testimony, it's important that the staff themselves also come from the community, right? And so I've been able to witness that most recently, actually on Saturday, I participated in an event which one of our community outreach staff belongs to. And it just makes a difference, when there's like that level of reach in immigrant communities and trust. And so that is certainly important for me to continue and to grow. We have an external affairs team, of which our community organizing and outreach teams belong. And so they work as a team to make sure that we identify the different immigrant communities that are going to be targeted any given week or month, depending on perhaps special events or outreach campaigns that we're working on. And this is led by our Deputy Commissioner of External Affairs. And so, in the next year and previous years, we've made sure that our staff are integrated into some of those planning of these events, whether it's ours or community-based organizations. And that's important because that's where those relationships are built. But in doing so, then we're able to also work closely with those community groups to provide the information, whether it's materials, literature, or training that the different communities need. Now, having been part of the other side of things, leading a community organization, I know that organizers and outreach staff are important for us to be able to access those resources in a timely manner, whether it's COVID testing vaccines, of which the community organization I used to lead benefited from, because we were in constant communication with Moya and were able to access these materials in a timely fashion. That's the case for all the community groups that we work with. And that is a critical, relationship that the team has. Now, Tom, if you can help me with some exact numbers, our outreach team has fluctuated in its numbers. So we have 10 outreach team members currently dedicated to this work, and currently have 5 vacancies.
And to build upon that, specifically for NYC Care Outreach, Moya funds and works together with 21 community-based organizations citywide that serve different immigrant communities in their language and in their neighborhood.
Great. That was going to be my follow-up, how you're working with community-based providers to increase enrollment. Thank you, Tom. And then, of course, in this past year's report, the work to reach our communities around COVID care and demystifying falsehoods around COVID was really pronounced in the report. Thank you for that. Thank you for your continued work. Could you share how you'll continue to inform immigrants about COVID resources? Will this work continue, and does the agency have the budget and staffing to do this work?
That's certainly a priority, although we're in a recovery phase and a reopening phase, this work for us continues, as we've discussed in the past and in my testimony. COVID-19 has impacted immigrant communities disproportionately, and it is going to take a while before communities are able to recover from this crisis. So we'll certainly continue to monitor as things change. But yes, outreach is a really important component. And just to clarify, we might have the lines specific to outreach and organizing, but for me, just like it was in my previous roles, the work of outreach and organizing must be integrated into the culture of the entire agency. So in that sense, we're all doing outreach and organizing together to make sure that wherever we go and represent the agency, we're also making sure that we are informing the communities that we're visiting and that we're in touch with. And so in previous years, we've organized days of action. Last year, we've organized about 70 specifically on COVID and vaccines. This year, we'll continue to organize these days of action to make sure that that is something that we prioritize moving forward.
Thank you. And I'd now like to go into questions about the adult literacy programs.
Sure.
I attended the DYCD hearing this morning and asked similar questions. And I know that you work very closely with DYCD, so would love to also hear from you. So the adult literacy funding is, of course, critical to support high quality community-based adult literacy instruction and contributes to the social and civic life of our most vulnerable immigrant New Yorkers. At DYCD's budget hearing, I asked the agency about the budget reduction for the adult literacy program. However, the agency had clarified that there's only a $1.6 million reduction due to underspending on case managers. It looks like DYCD was referring to the adult literacy pilot project. Can you confirm that the only reduction of $1.6 million on DYCD's adult literacy programs relates to the pilot project?
We'll have to get back to that. I want to take a look at it. I I defer to OMB they'll have more specifics, but I'd like to also look into this. As I mentioned in my testimony, we coordinate and have oversight of We Speak New York, which is really an important program that partners with adult literacy providers in the city. But but that program alone, is not enough. We know that, and so adult literacy providers play an important role in making sure that our communities are able to access those critical English language classes that they need. And so we'll defer to the OMB and also take a look into it to see what's going on.
Thank you. I'm also similarly investigating, and I see our friends from the Adult Literacy Network here with us. I'm excited to hear from them later on. What is the number of adult literacy participants in fiscal 2022?
Again, I don't have that data in front of me because we don't have oversight over this program, although I think this might be a moment to say that I think the more we can centralize things, especially programs that impact immigrant communities, the better, so that, we're able to most appropriately have oversight and be able to reach the communities that we need to reach. But I will get back to you on that. I do know from my time leading an organization that was a adult literacy program provider, there are a number of great agencies across the city that are able to provide adult literacy programs to their members, in a way that is also culturally appropriate to those communities. And it's important, for instance, in my work with day laborers, to be able to have those funds to support those specific communities.
I had wanted to ask this question later on, but given you brought up centralizing programs and the interagency relationships, do you see an opportunity here for Moya to become a department and not be a mayoral agency?
Well, because this does will take much more discussion, I think, in conversation between Moya, our sister agencies, and City Council. My impression is that there is a lot going on in the city that impacts immigrant communities, of which we're able to work in collaboration across agencies and programs as Moya is constituted now. I would not change that, but I think of course, as I just said, I would like to see some centralization so that we are able to appropriately have oversight and measure all the programs that are occurring that impact immigrant communities.
Thank you for that. On We Speak NYC, could you share what the budget is?
Yes. It's 873,000, and that's baseline.
Thank you. And how big are the We Speak NYC classes?
FY21, we had, let's see, I'm gonna need the support from my team here. By how big do you mean the enrollment size of the classes?
You can give me a breakdown of enrollment, recruitment, and then just, I know classes are being offered remote. Would love to know what the remote class size has looked like.
I can jump in, Commissioner.
Yeah, that would be great, Tom. Yeah.
Sure. So the class size varies. It's hard to give an average number of class size, but we can say that we served 3,407 learners in the fiscal year.
Tom, could you share why it's difficult to share class size?
Just because it varies throughout from class to class. And I don't have an average in front of me, but we can loop back with that.
Got it. And will the report that's coming out speak on this? I mean, it would be great to, have a sense of average class size and the way in which recruitment works and ensuring student success.
Yeah, you'll have that date, all that data available in the report. I don't know if you have average, but we can include that. But we have total hours served, which is 5,320. We have some interesting data there that you'll be able to review.
I'd love to follow up. So
And-
right
and-
now, it would be also good for me to learn how Moya is measuring the success of this
Mhm.
program.
Mhm. Yes, for sure.
Are you able to elucidate on that right now?
Oh, sorry.
I can jump in real quick as you're looking, Commissioner. So in the notes here, program capacity is 125 in-person courses, which serve between 2,000 and 2,500 students per year, and then an additional 15 online courses. And so if you're taking just the in-person courses, that's 20 per, and at the higher number, that's 20 per class. With respect to that, and that's going back to the question about class size. With respect to measuring efficacy of the program, I don't have that information in front of me, but we can loop back with that.
And it's I would say that, just to give a top line, it is, there is a program design. There are a variety of topics that are covered per course, including some of which I mentioned in my testimony. And then progress is measured against those topics. And so you'll be able to see in more detail how that is constituted.
Thank you. And I think that transparency is absolutely necessary given we speak NYC as a city's successful English language learning program that provides civic focused instructions. And it is just such an essential time that we continue this work. And so would really love the responses to my questions. I know that the program was being offered remote during this time. Could you share the attendance rate for remote classes versus on-site? Did we see an expansion?
Well, I'll have time maybe give the specifics, but I'll say that, like most providers who had to switch to online classes, there was also a necessary adjustment, like the adult literacy providers in the work, in how the work is done. And I know that surveys were used very consistently to track and monitor changes or potential changes to the program. And so it was moving to a virtual remote program design, but also, still with that ongoing evaluative process. Tom, did you want to provide more specifics?
No, I don't have anything to add.
Oh, you don't have any? Okay.
And then do you plan to keep remote classes available once in-person programming resumes?
Yeah, so though, like if you give me a yeah, no, I don't have the, I'll have to get back to you on some of the data points that you requested, but, we certainly do see some benefits in the virtual program design, but, we'll have to look at what works best, whether, a mix of both or going back to in-person.
Thank you, Commissioner. I'll certainly be following up, particularly because we know that through COVID, our immigrant communities faced not having broadband access, not having the tech tools required to continue receiving adequate services. And so we are seeing a trend in efficacy of programming offered remote. Would really love Moya to be proactive about ensuring that our immigrant communities have access to the digital ethos in programming. I'm curious now about how Moya is ensuring that undocumented youth, or in partnership with the other agencies, are a part of the Summer Youth Employment Program.
If I can answer quickly, go back to the adult literacy question. I certainly, when at my previous agency, we saw a shift between in person to digital. It was tough, and we also saw the challenges, that you mentioned. And there was sort of a moment where we needed to find the resources to make sure that people had, the computer literacy skills, or even just technology, something we're very mindful of and we want to be thoughtful of, certainly, not just at Moya, but in also supporting CBOs that are also trying to navigate the same issues. And, when it comes to the Summer Youth Employment Program, I think that is something that we're going to have a number of discussions to make sure that we're working with our sister agencies to make sure that immigrant communities have that information in place, especially at schools. But we're still looking into it. I know from your personal experience, it's complicated, right? Because if you're undocumented, that obviously the challenge is there. So we want to be really mindful, and we want to make sure that communities are aware of who can access this program and who cannot. But certainly for children of immigrants who are able to or DACA recipients who are able to access this program, it's critical that we're part of it.
That's great to hear. DYCD had given me a hopeful response in that they will be working with CBOs to ensure undocumented youth are included through SYEP. And so I will continue to follow that, and would really love the commitment of Moya to ensure that our undocumented youth are not left out, and that we do everything in our power to explore the mechanisms to institute a compensation model that really looks after our undocumented young people.
That's great to know. And if that, I'm curious to know more about that, and I'll certainly be reaching out. The team's going to be working closely with our sister agencies to make sure that we're able to communicate that, if that is a benefit, to communicate it with as many families as possible.
Thank you. Okay, now language access. Really, really glad that we are in agreement, and our mayor, that language access, language justice is crucial in cultivating, creating a sanctuary city. The idea of the language bank across city agencies is not new to the council nor to the administration. The city should implement Local Law 30. What happens when the council passes a law and the mayor's office and agencies don't follow? Someone needs to hold them accountable. The budget asks for $2.5 million for the language interpreter, legal language interpreter bank was called on the mayor to fund this. Can you give us an update on where the creation of the language bank sits right now on the negotiation?
Well, I guess, to start off, I'd like to say Anne is here with me, who has been an expert in champion of language access for many years, and is also here to answer questions and provide more details on what we've done at Moya, including technical assistance to sister agencies and our work with the mayoral offices. But I'll say, definitely we're at the starting, phase of budget negotiations and thinking through what, this might look like. And it's certainly, really important for us, and we need to commit, Moya, of course, to doing this work in partnership with city agencies and with the city as a whole, and with city council and with your leadership as well. And so, yes, I'd like to see many of these great ideas implemented, and also, of course, Local Law 30 be upheld and adhered to. And so I'll pass it over to Anne, who can respond some specifics around what we've been doing.
Yeah, so as the commissioner mentioned, Moya, this is an office-wide priority of Moya's, language access and language justice. We provide extensive technical assistance and support to city agencies, over 30 agencies, 20 mayoral offices. We provide translation and interpretation support to those offices as well. And we also are a language lab in terms of piloting new technologies and language access best practices and really sharing those out to city agencies. And as the commissioner said, we're open to exploring new innovative ideas as well.
Thank you, Anne. Could you tell me more about Moya's language services team serving as a language lab, like what that entails?
Absolutely. So we have a language services team that provides interpretation and translation to Moya and mayoral offices, and providing training to those offices as well in terms of language access obligations, the resources available to them. And then the team pilots technologies for improving language services. So for example, a few years ago, the team piloted the use of a technology vendor that supports a more automated process that allows us to human translate our website into the 10 local law languages. So we don't rely on Google Translate or automated translation, which as you know, there's lots of problems with that.
Thank God.
And this is new. This is a new kind of strategy. And so we piloted that. We have our website available in the 10 local law, 30 languages, human translated. And we have shared out those practices and those strategies, the use of this technology vendor with other agencies, some of whom are exploring now that as a solution to multilingual accessibility of websites. So that's one example. Another example is the use, our team uses computer-assisted technology, CAT tools, which helps aid in the quality of translations, the quality and consistency of translations. So using this technology to better the quality of translations is something that the team prioritizes.
How big is the team?
So the team is comprised of one baseline staff, one temporary staff, one fellow, and one baseline staff who oversees the team.
So 4.
And we have contracts with translation and interpretation vendors to support the translation and interpretation needs, although the team does in-house Spanish translation because we do have Spanish linguist capacity in-house.
So in-house translation only in Spanish, and then the other languages are outsourced?
That's right. And that's just for the mayoral offices. So that's not for the whole city. Agencies have contracted, contract with vendors to provide translation and interpretation support.
Understood. And then have you recently reached out to eligible CBOs on the creation of the language bank?
We have had some conversations with CBOs in the past about that.
And then in recent times?
We will be continuing those conversations.
Okay. And I ask because I know, as we talked about outreach around NYC Care and COVID resources, the emphasis was on our communities to be the ones empowered to be on the teams, the outreach teams. And so why is it that the language access is outsourced rather than relying on the brevity and diversity of languages that we all speak?
Yeah, it's a great question. And I think we're certainly open to ongoing conversations about this and figuring out the best ways to really build the city's infrastructure and the pipeline for for example, qualified interpreters, and to figure out the best ways to partner to do that work. So certainly open to ongoing conversations on that.
Yeah, I'd
You know-
love to.
Sure.
I'd love to follow up on this and see the ways in which the language services team could be an anchor in supporting community members who can provide translation, interpretation.
Mhm.
And just, oh, go ahead, Commissioner.
Yes, thank you, Anne, for that. And Chair, you're asking a lot of the same questions like I've been asking, as I came into the position, and Anne has been great in supporting me understand sort of the scope of this, which is huge, right? Because each of the agencies are responsible for adhering to local law, and it's I'm in awe in how big of a need is, right, for language access across the city. For me, and I know that the bank also includes some ideas around establishing cooperatives at local nonprofits. For me, it's also important to provide to assess and then provide the capacity building support that nonprofits would need to take on this work and be able to, contract with the city. So all of this goes hand in hand, and I'm very eager, to figure something out or work with you and with the CBOs and our sister agencies to work out some of these ideas and engage in the process.
Thank you.
And-
I'm with it. Yeah.
And there have been some good examples of practices of working with community groups. So Department of Health and Mental Hygiene had a contract with the Endangered Language Alliance to help support some of their work during the Bronx fire. In response to the Bronx fire, we connected the Office of Emergency Management and the Department of Social Services to International Child Program. And they provided some in-person interpretation on the ground in a variety of African languages. So there are sort of these good examples of utilizing, community-based groups that have these resources to provide that support.
Mm-hmm.
Thanks for sharing, Anne. Is there a separate report on how well the city is doing providing language access?
So actually coming up this local law 30 requires that we submit a local law 30 report annually. And so that will be coming your way in June.
Mm-hmm. And I have to say, Anne and her team are the ones compiling and working through, getting reports from different agencies, and we'll be happy to release that soon and review it with your office as well.
Wonderful. I am looking forward to that. And maybe as the immigration co-chair, personally visit the agencies to determine how they're doing language access. And I'd love the list of language access vendors that Moya is using or the agencies are contracting with, just to get a better assessment of, are we relying on partners outside of New York City and their track record? Really want us to hone in on language justice being something that we can build up by New Yorkers for New Yorkers.
No, and with that, and maybe I'll I don't know if you have that information, but we're also very committed to building our team around New Yorkers who are multilingual and who are able to communicate and are from those communities. And so not only are we thinking about contracting with, the different vendors, possibly CBOs, but also building up a team that's able to really communicate, in person as outreach staff of the city with the communities that we serve. And so that is for me a highlight and something that I'm really eager to continue building on. And do you have any specifics?
There's a number of different vendors, so I think we can get back to you on that.
Thank you. Would appreciate it. Now moving into legal services, and I have one more bucket for this round, and I'm gonna hand it over to my council colleagues and want to acknowledge Councilmember Krishnan is here as well. Commissioner, could you give us a breakdown of the fiscal 2023 preliminary budget allocated to immigrant legal services?
Sure. So for our, excuse me, for our response legal collaborative, we've allocated 800. Well, first of all, we have a $12.9 million budget allocated to our immigration legal services work. So for a rapid response legal collaborative, we've allocated 887,041, and that is baselined. And as I mentioned in my testimony or in a Q&A, that is work for those cases that are deemed as urgent, and often that is where folks are referred to from our hotline, where we get calls of people who have imminent deportation cases and such. Our NY citizenship program was allocated $250,000, and our Action NYC. Sorry, I'm a little confused here by the. I mean, what our Action NYC total?
I can jump in, Commissioner.
Oh, yes, Tom, please do.
Sure, yeah. Action NYC is baselined at 8.7 million. And then there's add-on funding to support the fellowship, an extension of the Action NYC hotline, and various other components. But in total, Moya's programmatic budget for legal services, immigration legal services, exceeds 10 million.
Thank you. And then how much specifically has been allocated to refugee services?
So Action NYC and Moya's immigration legal services are open to all immigrants. Some serve asylum seekers, family-based petitions, humanitarian and family-based applications mostly. Action NYC specifically serves individuals with straightforward cases, but consultations are available to all. And so refugees in New York City are typically supported by federally and state-funded refugee resettlement programs and agencies. And Moya is in communication with them often, but Action NYC doesn't specifically serve refugees.
Got it. Okay.
And Chair Hanif, apologies, I was giving you current budget numbers. I was confused by my binder, but in terms of proposed numbers, we should clarify, and Tom can give more specifics.
So then, Tom, just to clarify again, Moya doesn't provide specific legal services to refugees, but legal services are open to all.
Yes, open to all, including refugees.
Got it. The Biden administration announced 2 weeks ago, around March 3rd, it would give temporary protection to Ukrainians already in the US. What mechanisms are in place to help them navigate through this process?
So as Tom mentioned, we have our current immigration legal services. We're awaiting more details on what additional needs we might have other than support with TPS. And, traditionally Moya has been very responsive as those needs come up, right? For instance, with the Haitian relief work that we have done over the last couple of years. And, we're still working out our FY23 budgets, but we're looking forward to discussing these needs as they come up. Currently we're putting together our some of our basic, as I said earlier, outreach materials in different languages. We're clarifying what is it that the city can and cannot do, because so much of this, we depend on the federal government to take action. but we're certainly doing a lot of work. I myself have been to these communities a number of occasions, have engaged in ethnic media work, and I think New York has been a leader in making sure that we're thinking through what is it that we can do as a city to provide services to people as they come, and current immigrants from Ukraine and the community here are waiting for news.
Thank you. What would you say is the greatest need for the NYC or Action NYC rather in serving immigrants?
Well, we're certainly in constant communication, specifically Tom and the team, to really understand the needs that as they come up. Certainly, thinking through caseload and the kind of work that the collaborative is engaged in. And yeah, being able to be responsive to the needs as they come up in the various immigrant communities that we serve. As an example, as the example we just spoke about, Ukrainian is one, but there are many other communities who are, come from countries in crises, or even just immigrant communities that might qualify for benefits that, they might not know of.
And what has the caseload looked like year to year?
It's significant, and we understand, that there's a lot of need for this, and which is why we've advocated for a long time. Moya has, and I myself, for universal representation from the federal government. That is something that is still very important to continue to advocate for. The federal government has the resources to be able to make this possible for all immigrant communities that need the support. But Tom, can you provide a few more details on the work that's happening through Action NYC?
Sure. So in calendar year 2021, Action NYC providers throughout the city provided 11,467 comprehensive immigration legal screenings. That was an increase from calendar year 2020 of 30%. And that increase, there was a dip in 2020 due to COVID during those critical months of the initial onset. And so in terms of cases retained by Action NYC providers in calendar year 21, providers provided representation more than 6,000 cases, and that was an increase of 22% from the previous year. So in both screening provision and representation in 2021, Action NYC exceeded its targets.
That's really helpful to know. And Commissioner, could you describe any challenges outside of just like the sheer caseload and expanding caseload? What are some other challenges in this program?
I think we've learned quite a lot from working closely with advocates. I think no-show rate is often something that's discussed. Reducing that is important, using different strategies and making sure that folks who are reaching out for support were able to follow through and ensure that they're able to ultimately connect to resources. The assumption is that often people go and look for other resources elsewhere, including in the private sector. I think of course when we're speaking about being able to be responsive to immigrants as issues arise, there's challenges there. I mean, like TPS has been a form of relief that has been helpful over the past many years in the absence of a comprehensive immigration reform. But like the Ukrainian crisis, you just never know when that's going to happen or become available for communities. So this year, we're now looking to see, okay, how do we then provide support to this specific community? And as we continue to advocate for TPS to be provided for other communities, we're kind of in a waiting period, and so there's a need for flexibility there.
Understood. Could you describe the procurement process for selecting Action NYC service providers?
Sure. Tom, can you describe the process?
Sure.
Thank you.
So Action NYC was launched in 2015 into 16, and there was an RFP process conducted by Moya in collaboration with RF CUNY then, and it followed standard procurement practices. There was an RFP process, a procurement process under HRA in 2019 into 2020. And the purpose of that was to institutionalize the programs, ensure that they have multi-year contracts and can continue forward under HRA and a more established sort of procurement and contract management system. And there was a concept paper drafted and then multiple community events with potential providers in which they provided feedback, and then ultimately a formal procurement process under HRA, which lasted from November 2019 to around May 2020. And from there, contracting proceeded. The awards were evaluation was conducted under a number of categories: past experience at providing immigration legal services, community rootedness, language into in-house language capacity, and experience providing community outreach, as well as case management for non-immigration legal services.
That's helpful to know. And then how many responses did Moya receive for providers wishing to be a part of Action NYC in this fiscal year?
There hasn't been a call for proposals in this fiscal year for or applications to provide Action NYC service. We're currently not in a procurement cycle, and the current contracts they will terminate at the end of fiscal year 23 with an optional 3-year extension after. So we don't anticipate engaging in a new procurement process anytime this fiscal year.
So how many providers are there right now?
There are currently 18 contracted providers, but with subcontractors, that brings it to about 25 community-based organizations and legal service providers.
Got it. And then is there an evaluation that Moya conducts, or how do we ensure that access is equitable across all providers?
Yeah, we're continually assessing which community members and immigrant communities are receiving services. The Action NYC hotline is open to all, and then each provider submits a quarterly report to us with data breaking down the demographics of the populations they serve, as well as case types and things of that nature. So we do have detailed demographic and service information available.
Excellent. And do you believe that the number of providers is a sufficient amount?
I can say that, immigration legal service demand for those services is extremely high and will continue to grow. The capacity that we have is sufficient to meet the numbers that are contracted for, right, in what we allow for. I think that we have the RFP process was intentionally designed to increase equity of service provision, and it has been successful. More screenings and legal representation services are provided in hard to reach immigrant communities such as African, Caribbean, and AAPI communities since the RFP was culminated.
And Chair, this is exactly why I think we should continue to insist and advocate for universal representation from the federal government. We need to make sure that everyone that needs access to justice has it. And so we're committed to partnering with you, and I'm sure the community groups and advocates on the call to continue to call for this.
Absolutely, I'm with you on that. And then does Moya see a greater benefit in funding larger legal organizations that serve multiple boroughs versus the local homegrown CBOs and immigrant communities?
Well, I think there's there's a need for both. Certainly I come from the small homegrown, world. I've always worked with the smaller groups, having led one, I know that the benefits of partnering and working with those community-based organizations, as scrappy as we might look, and well, I'll let, I don't know if NICE is testifying today, but they can speak about the work that's happening on the ground. But certainly I think that the larger organizations that provide this work, are able to do so at scale and with the consistency and, the consistency that we need. So I think it's a mix. And, I don't know if Tom, you want to add to this, but I think we'll need to discuss capacity building and other work that we can do to help the smaller organizations, as we continue to contract with them.
Yeah, I agree with the commissioner completely. Both types of service provider are extremely important to ensuring that community members get the services they need. Action NYC is, most contractors are in the community-based organization program. So those services are being provided by CBOs immediately located in communities. The citywide services and Action NYC hospitals, libraries and schools are conducted by citywide service providers. And so the RFP and the way that our services are structured are designed to maximize the potential and the resources of both types of organization.
Thank you. That wraps up the first round of questions from me. I will now ask the committee council to call on any of my colleagues for questions for the administration.
Thank you, Chair. As a reminder, I'd like to ask if any council members have questions. You can use the Zoom raise hand function now, and we'll call on you in the order in which you've raised your hands. Not seeing any hands at the moment, Chair, so I'm going to turn back to you.
Thank you. Okay, so Know Your Rights. What is the budget for Know Your Rights in this fiscal year?
In this current fiscal year is $574,200.
And are you coordinating with other agencies on Know Your Rights in order to address topics such as education, health rights, housing rights, worker rights?
Yes, we have multiple teams working on, these various issues. It is, it's critical that our team is not only speaking about, what folks usually think of us as, like immigration legal services, but the breadth of services that the city is able to provide immigrant communities regardless of their immigration status. And so our contracted CBOs, providers cover many of these specific topics, because I think it's important to also contract with organizations that are working on the ground, but also have subject matter expertise. And of course, the staff are working closely to always identify communities that are underserved. And so for us, for myself, it's important to continuously be doing outreach and meeting new community groups. And like I said earlier, those who are contracted and are not contracted. And of course, key offices like city council offices to provide, partner and provide these Know Your Rights trainings to people.
Is there a public calendar of these Know Your Rights workshops? Or what is the frequency of them?
Well, I don't believe there's a public calendar, but we promote our Know Your Rights on social media and in our social media and with who we're partnering with. And I find that has been a very effective way to turn out individuals to our events, whether it's most recently, well, because of the pandemic, has been virtual, but we do a lot of in-person work as well. And community groups, again, regardless of whether we contract with them or not, are able to request these Know Your Rights trainings, and our team is able to figure out when it best fits in a calendar. So they're consistent throughout the month, throughout the week. And, we have staff that are, do these consistently enough to be able to turn around these trainings, in particular in the evenings and weekends, which is when most of these trainings are needed.
How many do you anticipate on hosting in the coming fiscal year?
Let's see. Do you have the number, Taple?
I can say that for the KYR program, which is through contracted services provided by community-based organizations, in calendar year 21, there were 242 KYRs held, reaching 8,567 people. So far in FY22, 3,041 people reached with 126 held. And so it looks like it would build toward about that same number, around 250 KYRs contracted. Separately from that, the Moya outreach team conducts their own KYRs. I can pull up those numbers as well. It looks like in 2021 calendar, organizing an outreach at Moya held 140 virtual and in-person KYRs, covering all topics. And most of those were provided on Moya's Facebook page, Facebook Live page as well. There were 58 in-person events.
Great, thank you.
And also to add, it's important to know that it's not just our organizing and outreach teams that provide Know Your Rights, but also in the contracts that we provide, our contracted CBOs, for instance, with Action NYC, they also provide necessary or critical Know Your Rights training. So it's really a priority across the board and across teams.
Understood. Now moving into IDNYC, how many IDNYC renewals have been made to date?
To date, let's see. Soon I will have these numbers off the top of my head, but I see we don't have those numbers. One of the key things, takeaways, is that this program is in partnership with the Department of Social Services. So, in their testimony, they'll be able to provide some specific numbers and more specific information. But if we find the numbers before the end of the Q&A, I'll give those to you. It is a priority for us. We want to make sure that IDNYC is renewed, which is why I have this here. Hopefully folks watching, please renew your IDNYC. We need to make sure that this ID is something that we're using, that it's important that a program such as this is only growing and being used. Again, we don't want this ID to just be used by immigrant communities, but by all New Yorkers. And speaking from my previous experience at a CBO, it's so important for our immigrant communities who don't have a form of ID. And so we want to make sure that this program is protected and used.
I look forward to that number. And just like, if you could elaborate the relationship between Moya and the Department of Social Services.
Yes, so IDNYC is operationalized by the Department of Social Services. As many of you know, it's a really big effort. There are sites when it's done in person all across the city. There's a mobile command center that moves around different communities. It's also important to I think, maintain the integrity of the ID, right? To be done by an agency, in this case DSS, that has the capacity to take on such initiative, which is why we work in collaboration with DSS that can provide and leverage the capacity of their staff to be able to execute on this program. Again, the ID NYC is a secure ID. It's an ID that that you are able to use for many things, and will continue to grow the usage of this ID over the coming years. Hopefully soon, we'll be able to announce a couple of new things, but it's important to make sure that this ID is reliable and that it's accepted in as many places as possible. And other states and other countries have actually modeled their municipal ID programs from ours. And so, again, one of the things that I've discussed, I believe, with many of you on this hearing, is that now with the availability of the state ID for immigrant communities, I think there's a question of, which to get, right, from our neighbors. And so we encourage to get both if possible, right? And to certainly get the ID NYC, which is your local municipal ID.
I'm with you on all of that. Could you expand on how you anticipate PEG cuts could impact ID NYC as you referenced earlier?
As I referenced earlier, we lost three positions. These came from our vacancies, and but it will not impact our current work. We continue to figure out ways to meet our goals in our work as is. So this is just to say that we didn't have to lay off anyone as a result. This came from existing vacancies.
Understood. In which ways is Moya increasing ID NYC enrollment? And what marketing campaigns has Moya initiated for renewals?
Yes, we are, and this is something that our team is given priority to. We do a lot on a daily basis to promote ID NYC, whether it's through our social media channels, but we do a lot of events, and we certainly communicate the importance of renewals through our KYRs and our other programming. We're about to launch a big renewal campaign during Immigrant Heritage Week. We're in planning stages to release some ads to make sure that as the spring and summer come along, people remember to get their IDs and also take advantage of the benefits that the ID comes, the discounts and access to cultural, services. We're going to be engaging quite a bit with ethnic and community media. That's a really important part of our work through Moya, but now through across city agencies. And so I'm going to be connecting with different outlets to be able to do that. We're going to be hosting an event, soon with Mayor Adams and DSS Commissioner to make sure that everyone knows that this campaign is launching and are aware of what we're doing. We recently had a number of events where we also highlighted the need for renewals and for the ID NYC to be prioritized.
Great, thank you. And really glad to know that ethnic media is being used more deliberately for outreach. It's encouraging to hear you say that New Yorkers should be applying for both IDs, ID NYC and the state ID. Do you expect ID NYC to become a permanent program?
So, I think the ID NYC is something that for many advocates, it's something special because we spend so much time and energy advocating for, and also the state ID. So it's both that we should continue to champion and protect and utilize, which is ultimately one of the most important things we can do, right? Because something that's not used is always, sort of questioned, right? Like why does it exist when it's not used? So that's why we are encouraging more people to not only get their ID if they don't have it, but renew it. And so, as to whether it becomes a permanent program, I don't think it's at risk at not existing. I'll have to get back to you on that question, but I certainly think it's important to use the ID so that it's not at risk at any point.
And then do you anticipate a need for additional resources in fiscal 2023?
Well, as we start the negotiations process, I would, I think one of the things that are important to us is to communicate how important the work is for not just immigrant New Yorkers, but all of New York City. I highlighted in my testimony how large of a immigrant community exists and the needs it has. And so I would certainly welcome additional resources if available. But, again, I'm committed to using the resources that we currently have at our disposal to meet, the challenges as they come up and work with our community very strategically in partnership with CBOs and other agencies. But again, I welcome the additional resources if they were available.
Of course. Are there any plans to expand the functions and benefits of IDNYC?
There are a number of the partners and benefits cycle, right? Some expire. Certainly when it comes to discounts in access to cultural institutions and so on. But yes, we're always looking into this. I'm always sort of it always like ideas come up and I'm like, hey, can we do this? I think that's one of the things that I encourage people to bring ideas and welcome your ideas as well to figure out how to expand what New Yorkers can use this ID for. When it comes to, whether, we can use this ID to prove identity for certain services, we're always in discussion, for those who don't yet accept this ID. And we certainly want to encourage more and more institutions to accept it.
Got it. Yeah, I'd love to host a IDNYC forum or a town hall with IDNYC recipients to really better understand how the program can be evaluated and what else it can do to serve New Yorkers more efficiently.
Well, since I have the chance here, if there are any council members who have not renewed their IDNYC, we could certainly do a big event around that.
Let's do it. That's a great idea. That's a great idea. The Immigration Committee can co-sponsor that. I'd now like to move into one question I have about serving immigrant survivors of domestic violence. To what extent is Moya involved in serving immigrant survivors of domestic violence?
That's I think survivors of domestic violence, it's one of those issues that certainly in my time at NICE, it was something that throughout the pandemic, it was top of mind. We saw a lot of instances, right, of these cases, and often a lot of the serious, more challenging cases would come to me as the executive director to try and figure out what we can do, what was possible or not. So I recently had a meeting with the committee, the agency that is in charge, right, of looking into this and how we can partner, whether it's utilizing their existing resources, perhaps writing op-eds together. I think there are many ways in which we can continue to strengthen that work. One of which has always been making sure that immigration legal services are offered to survivors. That is a vehicle that is always anchors our relationship, and the commissioner agrees that we can do more, right? We have a role in coordinating UNT visa certification, and so I think that is always a case. But the agency has these family justice centers in each of the boroughs, which I think we could be more precedent present in and be able to collaborate more. And that was a fascinating conversation I had with the commissioner. I've been meeting with many different commissioners, but I'm really looking forward to working with that agency and of course the city council to making sure that we're expanding that work.
Thank you. That's encouraging to hear. I'd now like to move into MOCs and city contracts and then wrap up with the Moya headcount. There's a growing number of community-based organizations facing challenges with the city's contracting process. That's nothing new. How often does Moya engage with the Mayor's Office of Contract Services on the city's contracting process?
I think I have a meeting with the commissioner there and with staff. I want to bring my experience, having worked now in the nonprofit space for so many years, and maybe get some stuff off my chest, because I know how challenging it is. I know that the many barriers exist, but recently there was a couple of announcements. I think there is a consensus across the city that we all need to work on this to make sure that it's a process that is able to help community organizations, right? Strengthen their work and grow their work instead of the opposite, because it could derail an agency's sort of mission and it can put them at risk when not done appropriately. So contracting is really important for me to be able to provide immigrant CBOs, capacity building, and think through, what are the challenges and how do we work with MOCs and others to make sure that those are being looked at. Yeah, I mean, I can't lie, there's a lot of work, to be done in this area, but certainly I can provide from personal experiences how that's like on the other end, and work with other CBOs on this call, I'm sure, to highlight how we can do this better. It certainly is top of mind for me.
Understood. And I hope some of the groups testifying today will add to this conversation later. And now wrapping up with headcount, could you elaborate on the staffing structure at Moya?
So when it comes to structure, we have a pretty amazing programs team that do a lot of the work that we describe here today. And that's where a lot of our immigration legal initiatives live, and certainly a lot of the work that Tom described. We also have our the work that falls more under what do you call it, policy work and interagency work, which is a lot of what Anne described in our efforts to ensure all agencies have the support they need to adhere to local law 30, and also a lot of our other policy initiatives that you heard from today, and certainly our advocacy work. And then there is our big external affairs team that is in charge of making sure all this information and services get out to the community. And I think Moya has been a model to other agencies across the country on how to do outreach and organizing, right? Having neighborhood organizers and also outreach staff working hand to hand to make sure that we're going deep into community work. And so those are the three main pillars of our agency as it stands. And certainly, like most agencies across the city, when there's a fluctuation of the number of staff we have, right? And because of what you described at the beginning of your testimony or your comments, we work a lot in partnership with other city agencies. And that is both, something that, can present some challenges, for sure. When you work collaboratively other agencies, you have to make sure you're on the same page. You work, you often share staff and resources. and then there's opportunities. We are able to work with a number of different agencies, right, that do work across the city. And I'd like to continue to expand on that, because as we discussed, I think it was in the last hearing, there are opportunities to do this work with the DOE, for instance, or increase our work with our other agencies that have not traditionally been associated with MOYA. So yeah, that's sort of the basic structure currently as it stands.
So are you able to provide me with a number? I know that Moya's headcount includes 7 positions, but how many folks are working in the agency, including from the other agencies?
Oh, I see. So like you said, we have the budget that we're provided with every year, and that's where the headcount that you mentioned comes from. But then associated staff, meaning staff that we work with that come from other agencies, the total number or the total world universe is 72, I believe. Yes. But obviously, like I said, this fluctuates depending on the initiatives that we're working on, and depending on sort of whether we fill vacancies or not, and how that works. I will be able to provide a little more information as I learn more myself about how this looks like. But yeah, that's definitely something I'm looking into as well.
Thank you. And then among the 7 MOYA positions, are there any vacancies? And then could you walk me through any other vacancies? I know you mentioned 3 vacancies in the outreach team.
I don't believe there are any vacancies amongst the core staff, but I certainly, yeah, let me get back to you on that. Not on the core staff, certainly, but in the other positions. And again, like I described earlier, IDNYC has a massive staff. I didn't even discuss that with you. That is a program that we work on with DSS or at the Department of Social Services and HRA. They should be able to provide more of a headcount. That is where most of the vacancies exist. But I can provide that detail for you, or they can provide it. Yeah.
Yeah, I would love to know that. And then if you could clarify, I know we've sort of had the scattered conversation around the teams at MOYA. How is the workload split among MOYA staff?
Like I said, there's a little bit of fluctuation here because of whether it's vacancies or initiatives that end or are launched, but the programs team carries the load. It's a significant amount of work that the programs team carries, but there are different initiatives, right, that are launched or renewed or end there. Then our policy team, who is in charge. This is a different team who's in charge of looking at our policy work and our legal work, making sure that, frankly, the city is adhering to the different laws that it needs to adhere to that impact immigrant communities. That is a team that takes on that work. We are currently hiring for a general counsel. That is the one position that exists there that is most critical to fill soon. And then there is our external affairs team, which I described, holds on to, or that's where our organizing and outreach team lives. And that does a lot of very substantial and critical work, because that's where we partner on different initiatives with other agencies. And so that's where, for instance, the staff we share with IDNYC and DSS live, and that's where we do most of that work. I don't know if that helps.
That certainly helps. And as a follow-up, would you say that Moya has sufficient staff to conduct all services?
Oh my God. I mean, that's like I said earlier, I certainly welcome additional resources if available. I know we're just starting this conversation, and I'm very hopeful that we'll continue to strengthen our team and grow it, to be able to meet the needs that our community has. I think, in my testimonies, I make it clear, that, we're taking on these sort of big initiatives and want to make sure that our communities receive the services they need, and we're looking after their well-being. And, like I said, I welcome any additional resources.
Amazing. Thank you so much. Well, that's
Thank you,
all
Chair.
I've got for the administration. If there are any colleagues of mine who would like to ask any questions, I'd like to open that up. And if not, we can move into public testimony.
Thank you, Chair. I'm going to ask one more time if any other council members have questions. You can raise your hand now. I see that Council Member Sanchez has a question. Councilmember Sanchez, you may begin your question when the sergeant cues you.
Excellent. Well, I first want to just commend and thank the chair for your thorough line of questioning. I think that there's a lot of outstanding items that we would all, benefit from learning more about. One thing that stuck out to me earlier was the conversation around class sizes in our adult literacy programs. It'd be very, very helpful to have an understanding of that once you all can pull those metrics more clearly. I actually don't have a question at this time. Commissioner Castro and team, I just actually wanted to thank you for your presence at the Twin Parks Northwest fire response. You and your team were there at the service center, which is in my district, in District 14, day in and day out for a very long time. And I just want to acknowledge and thank you for that, because you provided language access, you provided, a sense of security for folks who had lost all of their documents, had lost so much during that emergency. And, that's precisely the kind of work that, I look forward to continuing with Moya is, having you be more, just beefing up your capacity to do even more of that, right? To be there for our communities, and help us to cut through red tape in terms of, serving our constituencies. So I just want to thank you for that and thank the chair for your incredible thoroughness on this hearing.
Thank you so much, Councilmember Sanchez. And I too was out there in the Bronx and saw Moya folks, some of whom are some of my closest homies in this work, and really just thank you so much, Commissioner Tom, Ann, and the rest of the Moya team for all that you do. And, I'll continue to make sure that my line of questioning remains thorough, only because we need Moya to continue to do the work that is urgent, proactive, responsive, and the best agency that it could be for immigrant New Yorkers, our undocumented New Yorkers and families and children. Really, really looking forward to our continued partnership and ensuring efficiency at the agency.
Thank you, Chair, and thank you, Councilmember. I'm just going to ask one more time if any other council members have questions at this time. Again, you can use the Zoom raise hand function. Not seeing any hands, I'm going to thank this panel for their testimony. Thank you to the administration. And now we'll be moving on to public testimony. All public testimony will be limited to 2 minutes. We have a large number of people signed up to testify, so we ask that everyone please stick to their allotted 2 minutes. Again, thank you all for your patience. We will definitely hear from each and every one of you who is on the call. If anyone has to drop off, you can submit written testimony to testimony@council.nyc.gov, and your testimony will become part of the record, and we ensure you that we will read every word of your testimony. I'll now be calling on panelists to testify. After I call your name, please wait a brief moment for the Sergeant at Arms to announce that you may begin before starting your testimony. And please note that panelists will be able to register for this hearing until the hearing is closed. The first public panel in order of speaking will be Ellen Pecknanda, followed by Carla Ostalaza, followed by Deborah Lee, followed by Sharon Kaufman. I'd like to now welcome Ellen Pecknanda to begin your testimony as soon as the sergeant cues you.
Time starts now.
Thank you. Good afternoon, Chair Hanif, and thank you again for the opportunity to testify. My name is Ellen Pecknanda. I'm the attorney in charge of the New York Immigrant Family Unity Project, or NYFUP, at Brooklyn Defender Services. As you know, NYFUP is funded by the City Council, and it is the country's first publicly funded universal representation program for detained non-citizens facing deportation. We are here today asking that the council continue to fully fund NYFUP, now the national model for immigration defense from detention and deportation. I will quickly outline how NYFUP fought and continues to fight for the lives of New Yorker immigrants in detention during the pandemic. As this council knows, in March 2020, we sprang into action, working long hours to fight for the release of clients from life-threatening conditions as COVID-19 began to spread in the jails and detention. During the height of the pandemic, the 3 NYFUP offices have filed hundreds of federal court actions and won the release of 240 people as a result of our litigation and advocacy. In late 2021, despite termination of ICE contracts in New Jersey facilities, ICE refused to release a majority of detained immigrant New Yorkers, instead transferring them to Orange County Correctional Facility. The conditions in detention in Orange County are inhumane. Immigrant New Yorkers are subject to medical neglect, abuse, harassment, and to the dangers of COVID-19. Our offices continue to advocate and demand for the release of all immigrants detained in Orange through release requests, habeas actions, and changes in law. We applaud the council for passing Resolution 0066, calling on our state to pass the Dignity Not Detention Act, ending contracts with ICE for immigrant detention, and look forward to continuing to collaborate with this committee to end immigrant detention. Thank you.
Thank you for your testimony. I'd like to now welcome Carla Ostalaza to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Hi, my name is Carla Ostalaza. I am the Managing Director of the Immigration Practice at the Bronx Defenders. In my testimony, I will explain why the work of NYFUP continues to serve a critical role in protecting immigrant communities from ICE's surveillance, policing, and arrest. NYFUP staff have been fighting for our clients' freedom with an extreme sense of urgency, given the torturous conditions and high risk of serious illness and death posed by immigration detention during the pandemic. While we have often been successful in our advocacy, many clients were released subject to electronic surveillance by ICE and are at a high risk of redetention. We will continue working diligently to reduce the risk of redetention of our clients and will remain vigilant and ready to assume representation of new clients as detention rates continue to rise. The immigration courts have also played a significant role in eroding our clients' rights by prioritizing expediency above anything else. Although the Justice Department formally ended the case completion quota system for immigration judges last fall, we have not seen any changes in the practices of immigration judges in the detained docket. With our clients being regularly forced to trial within weeks of intake, we're actively challenging these practices through multiple appeals. Non-detained immigration courts present their own challenges to our ability to preserve our clients' rights and to manage our workflow. Over the last year, non-detained immigration courts have adopted the practice of issuing scheduling orders, hoping to expedite case completion. The orders instruct parties to submit all the evidence relevant to the trial, while no trial has been scheduled. The evidence submitted will surely be stale at the time of trial, but failing to submit this evidence will result in a finding that our clients have abandoned their claim to stay in this country. DHS also has launched its own initiative aimed at reducing the immigration court backlog. Last year, ICE announced guidelines for the favorable exercise of prosecutorial discretion for cases pending before the courts. Every person in the
Expired.
Thank you. Just one thought. Every NYFUP continues filing these applications for every client, and this work will continue into fiscal year 2023. Thank you.
Thank you so much for your testimony. I'd like to now welcome Deborah Lee to testify. You may begin when the sergeant cues you.
The time starts now.
Hello, my name is Deborah Lee. I'm a Deputy Attorney in charge of the Immigration Law Unit at the Legal Aid Society. Thank you, Chair Hanif, and other council members for the opportunity to address you. In addition to the other NYFIP partners that have already testified, I wanted to just highlight that ICE raids, while they have been lower in the past year, we do anticipate that they will increase in the near future. We need our staff to be fully available to respond to ICE detention activities. We are seeking an increase from 16.6 to 18 million to help address our increased costs. In addition to NYFIP support, the council has been a steadfast supporter of unaccompanied minors since 2014 through the Unaccompanied Minors and Families Initiative, which is granted annually to legal aid, and our partners, the iCare partners that we have. And for fiscal year 23, iCare is seeking an enhancement to $4,570,000, $1,075,000, which would be for legal aid. And this would offset a loss of funding from the Robin Hood Foundation, which was a temporary funding source that will end this fiscal year. We also applaud the city for its ongoing support for removal defense and affirmative immigration benefits work through the Immigrant Opportunities Initiative. And we encourage the city to continue its flexibility it adopted in the last 2 years regarding meeting deliverables through units of service. And we ask the city to support continued funding for our low wage worker initiative. Finally, we're seeking $710,000 for our immigration federal practice, which allows us to continue our cutting edge work, litigating on behalf of our clients. Thank you very much.
Thank you so much for your testimony. I'd like to now welcome Sharon Kaufman to testify. You may begin when the sergeant cues you.
Time starts now.
I was speaking on behalf of legal aid, so Sharon is not going to be testifying.
Okay, thank you so much. Chair, that concludes this panel. If you have any questions or comments.
Thank you so much, Ellen, Carla, Deborah, and Sharon. Or actually, Sharon's not speaking. Deborah, could you run through the numbers one more time, the budget allocations and the increases?
Sure. For each of the different initiatives. Sure. So for NYFIP, it's an increase from 16.6 to 18 million. And that's spread across the 3 partner agencies within NYFIP, spread evenly across. And then the Unaccompanied Minors and Families Initiative, that's with iCare, the iCare partners, that would be an enhancement to $4,570,000, $1,075,000, which would be for legal aid. And it's again, just to offset the loss of the Robin Hood Foundation funding. For the federal practice, legal aid's immigration federal practice, which works on impact litigation on behalf of our clients, as well as clients more broadly, that would be seeking $710,000 to help us with our work.
Got it. And then you, the idea is to sustain the low wage worker initiative?
Exactly, to sustain it.
Okay. Could the 3 providers share any challenges or issues beyond just the budgetary limitations you face as providers?
I don't know if Ellen or Carla want to speak on behalf of NYFIP.
Hi, yes. So there are several challenges aside from the budget constraints. One, I was talking about a lot of challenges that we're facing in terms of how to manage our workflow and how to protect our clients' rights, that are challenges that are coming from the courts. Aside and their interest in expediting every case above any other consideration and imposing a lot of arbitrary deadlines. There are other challenges as well in contracting and having our contracts registered timely with the city that also impose additional challenges to the administration of the program.
Got it. And then I just want to, show my tremendous gratitude. The Reso 66 passing is thanks to all of you and all the advocates present here and those who were present at our first immigration committee hearing a couple weeks ago, and to hear from formerly detained, currently detained neighbors at Orange County was so powerful and moving, and absolutely affirms my commitment to ensuring that we end immigrant detention in all facilities. So I hope you can count on me to, fight as hard and loud as possible to ensure that we abolish ICE and abolish these jails in our city. Bonnie, we can move on to the next panel.
Thank you, Chair, and thank you to this panel for their testimony. We'd like to now welcome our second public panel. In order, I'll be calling on Monique Francis, followed by Alan Wernick, followed by Mitu Dhar, followed by Mario Russell, followed by Melissa Peterson, followed by Alexandra Rizzio, followed by Jenia Blaser, followed by Ali Finn. Monique Francis, you may begin your testimony when the sergeant cues you.
Time starts now.
Good afternoon, everyone. Thank you, Chairperson Hanif and members of the Immigration Committee for inviting us to testify today. As mentioned, my name is Monique Francis. I am the Deputy Director at CUNY Citizenship Now. Joining me today speaking with Mitu Dhar, our Managing Attorney for Community of City Council Services. So we are here to testify today in support of the citywide council initiatives that provides funding, which allows us to assist New York City immigrants all on the path to U.S. citizenship. As you all know, CUNY Citizenship Now is the largest university-based program in the nation. We are trusted and safe space for immigrants. We provide free, high quality and confidential immigration law services to all New Yorkers, no matter their affiliation with CUNY. We aim to educate immigrants communities on the path to citizenship and demystify the regulations as they access immigration benefits. Our attorneys and paralegals provide one-on-one consultations to assess immigrants' eligibility for legal benefits and assist them when qualified. We currently are in 42 city council offices, and since the inception of the program, we have assisted 58,000 immigrants. As a whole, the organization helps over 140,000 immigrant New Yorkers so far. We're asking for an increase from our $3 million to $4 million for the upcoming fiscal year to address the growing demands for services from the immigrant communities citywide. While the pandemic hampered our delivery of in-person services, in FY 2021, we were resilient in our efforts in helping 4,634 constituents virtually in a number of online platforms and over the phone. In the fall of 2021, we did resume in-person services at a number of our locations, and to date in FY 2022, we've provided services to more than 3,072 immigrants at our offices and community events.
Thank you so much for your testimony. I'd like to now welcome Alan Wernick to testify. You may begin when the sergeant cues you.
Your time starts now.
Okay, thank you. I'll just continue. Well, I'm sorry, we were anticipating a little bit longer presentation. I apologize. So we are seeking to expand our pro se model. Our goal is to reach all immigrant communities in New York City. We have access to a language line, allows us to communicate in over 180 languages, but we don't think that's sufficient. We are hoping to serve the community more effectively and looking to hire additional foreign language speaking attorneys and support staff. And we're also outreaching to our wide student base for language assistance. We are also looking to increase our service days at city council sites. The current city council is particularly attuned to the needs of New York immigrants. Already new members are asking for services in our districts unserved by their predecessors, and others are asking for an increase in services. So we believe that there is a growing need for the services that Citizenship Now provides, and we need your support in helping the immigrant community navigate the complexity of U.S. immigration law and provide them a path to U.S. citizenship. We aim to reach every immigrant in need of immigration services, and together we think, working with the council, we can help immigrants rise from the pandemic with a pathway to U.S. citizenship.
Thank you so much for your testimony. I'd like to now welcome Meethu Dhar to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Thank you, Chair Hanif and Committee on Immigration. Again, my name is Meethu Dhar, and I'm the managing attorney at CUNY Citizenship Now. Just to add a little bit more to what my colleagues have said, to continue with our testimony, as we emerge from the pandemic, it seems unlikely that broad immigration reform will become a reality in the upcoming year. Still, we're hopeful for new opportunities for New York's immigrants, an example being the recent grant of TPS to Ukrainians. CN, with the support of City Council, has the ability to respond quickly to changes in immigration policy. When DHS announced TPS for Ukrainians, we immediately implemented a plan to help this community. While our core service to the community is helping immigrants become U.S. citizens, we also assist New Yorkers petition for relatives to bring them here from abroad, and we also help many in adjusting their status in the United States. We prioritize those individuals who entered the United States as children by assisting individuals apply for DACA renewals, and advanced parole applications. We've also dedicated City Council-sponsored days solely to assisting those constituents applying for TPS, DACA, and green cards. An important part of our Pro Se model includes our large-scale City Council-sponsored Saturday citizenship events. These Saturday bi-monthly events allow us to reach a broader segment of the New York City immigrant community. Another important component of our Pro Se model is prioritizing the education of New York City's immigrant population on emerging immigration issues. In partnership with the City Council, we aim to reach out to the immigrant population before notarios and unethical businesses prey upon them. We disseminate information to the community on the constantly changing immigration policies through media promotions, briefings, presentations at town halls, immigration forums, and Facebook Live events. Again, there is a pressing need in New York City for the services that CN provides. We need your support in helping New York City immigrants navigate the complexity of U.S. immigration law. Thank you so much again, Chairperson Hanif and members of the committee for inviting CUNY Citizenship Now on this very important hearing today.
Thank you so much for your testimony. I'd like to now welcome Mario Russell to testify. You may begin as soon as the sergeant cues you.
The time starts now.
Good afternoon, Council, Chair Hanif, and members of the Council Committee on Immigration. I'm Mario Russell, Director of Immigrant and Refugee Services at Catholic Charities. Thank you so much for the opportunity to testify today. For more than 40 years, Catholic Charities has welcomed New York's immigrants, refugees, and those who've been undocumented for many, many years without a pathway forward. Each year, we serve almost 100,000 through our Division of Immigrant Refugee Services in basically 6 main areas. Work with refugees, resettling those, about 600 a year, advice and legal representation to between 5,000 and 8,000 adults in proceedings, legal assistance to about 5,000 children, unaccompanied children each year, again, who've been transferred from the border and placed in detention shelter facilities in the New York area. We provide work-related job development, theft prevention, wage assistance, and other remedies for day laborers, about 1,500 of those in the Bronx. And then, of course, we provide information referrals through our Action NYC hotlines and English instruction to about 800 each year. But most importantly, with new global crises emerging and continuing, whether it's Ukraine or Afghanistan, we have also understood the need to be present and responsive. With the evacuation of over 76,000 from Afghanistan, we have worked to resettle over 100 individuals now in New York City and in the New York area. And we're working now to develop proper legal responses and resettlement responses to those who will, of course, be coming from Ukraine, making their way to the US. And someone asked earlier the question, what about refugees? It may have been, in a sense, a technical and legal question, but I think it's actually a substantive and a moral question. What is the city doing with refugees? And really that means asylees, asylum seekers. There's a lot there to be done. I'll end my testimony simply by offering continuing appeal to this council's support of the initiatives that have been discussed, the legal ones, absolutely importantly, the Haitian Response Initiative, absolutely critical unaccompanied children, and in particular the Terra Firma program, which you know is a medical partnership in the Bronx. And I want to stress again the loss of Robin Hood, which has been said so by my colleagues, the Action NYC hotline, which is critical, and of course, work through our ESL language programming. Thank you very much for the time.
Thank you so much for your testimony. I'd like to now welcome Melissa Peterson to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Afternoon, and thank you for this opportunity to be heard. My name is Melissa Peterson. I'm a supervising attorney at the Doors Legal Services Center. We receive city funding through the iCare Coalition, and with that funding, we represent nearly 200 immigrant children and youth facing deportation in New York City each year. Under the Doors holistic and client-centered model, we provide members with a variety of resources in addition to legal representation, with the goal to empower them and to help them achieve long-term success and stability in the US. We have an integrated social work team that works closely with our immigrant youth to provide needed support in their cases and connect them with other in-house services, such as healthcare and supporting housing, crisis assistance, free nutritious meals, career and education services, creative arts, and community-centered programming. So continued economic support from City Council is imperative to support the remarkable people that we work with now more than ever, because the iCare Coalition has lost private funding for the next fiscal year. The harmful effects of the anti-immigrant policies of the previous administration are not gone. We're still up against restrictive policies that directly affect our young people, and we have seen increasing delays with USCIS since the start of the pandemic, with a great number of our young people waiting years for answers on their immigration applications. This leaves many of our young people in a state of limbo with no legal status, limited access to public services. Furthermore, a drastic recent change in the Department of State visa bulletin affects a large number of people that we work with. With this change, people from Honduras, Guatemala, and El Salvador who have been granted special immigrant juvenile status may be waiting more than 5 years before they can apply for legal permanent residence in the US. This will be particularly challenging for those who are approaching adulthood and trying to plan for their future. It will also require greater legal advocacy for those with active cases in immigration court. So continued funding through iCare in the fiscal year 2023 will enable us to provide our young people with the legal advocacy and the supportive services they will need during this challenging time. Thank you.
Thank you for your testimony. I'd like to now welcome Alexandra Rizzio to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Thank you to the Committee on Immigration and Chair Hanif for inviting testimony today. My name is Alexandra Rizzio, and I'm a managing attorney at the Safe Passage Project, a nonprofit legal services organization that provides representation to immigrant children facing deportation. We serve children who live in the 5 boroughs of New York City and the 2 counties of Long Island. The City Council has been a stalwart supporter that allows us to fight on behalf of young immigrants. You fund our work through the Unaccompanied Minors Initiative and the IOI grant stream. Without this support, which we've had since 2014, we would not be able to serve the over 1,200 clients that Safe Passage currently works with. Organizations like Safe Passage are facing unprecedented challenges. First, a record number of unaccompanied children arrived at the US-Mexico border in 2021, over 100,000 of them. Some of these young people had been expelled from the border under the Trump administration due to specious public health rules and are only now being processed according to the law. At least 10% of them are headed to New York to reunite with family members, but they will be simultaneously placed into removal proceedings and will need attorneys. Second, cases continue to take an extremely long time to resolve, meaning that we cannot turn over cases as rapidly as we once could. Our caseloads continue to grow. Third, the COVID-19 pandemic has laid bare and heightened many of the inequalities in our system. Undocumented immigrants may work in essential jobs, but most lack job security, are less likely to have health insurance, and may be hesitant to seek emergency medical treatment. At the same time, our immigration work hasn't stopped. Filings still have to be made on time. Kids were being entered into removal proceedings and they needed lawyers. So Safe Passage Project and our fellow organizations have continued to do this work. With the City Council support, Safe Passage Project and our partners will hopefully help even more clients navigate the maze that is the immigration system, defend them against deportation, and help them access stability and essential services. Safe Passage Project offers our sincere thanks to the City Council for being a leader on the issues of legal representation in immigration court, especially for children, and for caring for all New Yorkers, regardless of immigration status. Thank you.
Thank you for your testimony. I'd like to now welcome Genia Blazer to testify. You may begin when you are ready.
Time starts now.
Hi, thank you, Chair Hanif and the Committee on Immigration. My name is Genia Blazer, and I'm a supervising attorney at the Immigrant Defense Project, and I'll be testifying about the critical work of IDP's hotline for detained New Yorkers. IDP has submitted an application for council discretionary funding to support this work, which we'll submit again with our testimony. IDP is the only organization in New York devoted specifically to fighting for justice for immigrants caught at the intersection of the racially biased U.S. criminal and immigration legal systems. We've been running a free of charge hotline for over 20 years. Our unique hotline provides information, referrals, and legal analysis specifically to immigrants who come into contact with the criminal legal system and those who are arrested by ICE. In addition to providing constitutionally mandated advice about the immigration consequences of convictions to assigned 18B criminal defense attorneys in all 5 boroughs, IDP's hotline is a vital space of immigration information for immigrant New Yorkers and their families during times of high stress and often unexpected contact with the criminal or immigration systems. NIFUP, who we just heard from on the last panel, and the Rapid Response Legal Collaborative, who I think we'll probably hear from soon, are key programs for many of IDP's callers. These programs exemplify New York City's commitment to due process for detained immigrants. Our hotline also supports detained immigrants. We're often the first to provide orientation to the criminal and immigration systems for immigrants. We help families locate loved ones who have been taken by ICE or who are in criminal custody, and we work with detained people and their families to assess options, including potential legal referrals. This work has become all the more critical now. ICE uses jails across the country to detain immigrants, and the bed space in the New York City area jails has greatly decreased. We're hearing from community members who are detained by ICE as far away as Louisiana, Texas, and Alabama. And as you know, in the immigration system, New Yorkers arrested by ICE have no right to be detained or have their immigration case heard near their residence. Our work plays a crucial role. Sorry. I'll just end by saying that we've been trying to absorb the increased work of serving detained New Yorkers across the country and their families in the city, and would benefit greatly from the proposed funding and support of our hotline. Thank you.
Thank you for your testimony. I'd like to now welcome Ali Finn to testify. You may begin when you are ready.
Time starts now.
Thank you so much to Chair Hanif and to the committee. I'm also here today from the Immigrant Defense Project, but would like to speak about the importance of maintaining the IDNYC program and protecting it against attempts to add a smart chip or to digitize the ID, which would have dire consequences for immigrants and their communities and other communities. IDP and 65 other organizations who were key to the success of IDNYC and its initial implementation spoke out against de Blasio's plan to add a smart chip to the ID in 2018-19, citing unacceptable risks around privacy, surveillance, and financial equity. All of these risks very much still hold. The current status of the plan to digitize the ID is unknown, but we are deeply concerned about Mayor Adams' campaign statements to enhance the IDNYC program and digitize city services, including a My City platform to access city services and benefits, and a plan to add a chip to the ID. While the mayor framed this proposed plan as one of convenience and modernization, digitizing IDNYC poses monumental risks for a wide range of New Yorkers, especially undocumented immigrants. We have been stating and repeating these same risks since 2014. These risks include increased surveillance, monitoring, policing, and data collection without consent on Black, Brown, and immigrant communities already subject to discriminatory policing and invasive surveillance, excluding residents from key city services, exposing governments and residents to massive data breaches, and eliminating needed resources for community-led initiatives and long-term urban planning, and redirecting those resources into business-led technological interventions that consistently fall short. We need to preserve the IDNYC as is and protect the privacy and security of all cardholders. There is no other government-issued ID that offers the same level of protection for undocumented immigrants from intrusion by police and ICE. And we urge the council, Moya, and the other relevant mayoral offices and agencies to refuse digitization, and especially to refute claims that digitization is needed as a way to cover the program's costs and ensure its sustainability. My last point is that we ask the city to involve stakeholders, including the community-based organizations and advocates essential to the program's success at the start of any proposal to change the IDNYC. Thank you.
Thank you so much for your testimony. I'd like to now turn it to Chair Hanif for any questions or comments.
Thank you all so much. Really look up to the groups that shared testimony. Appreciate your continued work. To the CUNY Citizenship Now team, whom I love, and we're hosting a day of action in the 39th at the end of this month, which I'm really looking forward to. And in my district alone, and I'm sure this is the same for others across the city, it was the single most used legal services in the 39th when I was a staffer at my predecessor's office, former council member Brad Lander. So I'm excited about the continued work and your own sort of acknowledgement of some of the language access shortcomings. Would love to learn a little bit more about how many citizenship applications CUNY Citizenship Now filed in fiscal year 21 and 22. Alan, Mitu.
Could you
Yeah.
Could you unmute Monique, please? She's the one that's prepared to answer those questions with the numbers.
Sure.
1 second. Mitu.
I can give you the numbers that we completed this year so far, this fiscal year. For the number of citizenship applications completed so far, it's 192. As far as consults are concerned for citizenship, we've done 734 for this fiscal year.
But we should point out that, of course, our numbers are much larger pre-pandemic. With the challenges of the pandemic, doing the work remotely, substantially lowered the number of applications that we were able to prepare.
And could you share, and this is a question broadly to the others in this panel, how you've been able to innovate and continue providing services remotely?
Sure, I can. Oh, go ahead, Monique.
Okay, go ahead, me too, it's fine.
So we've been off, we're actually transitioning back to in-person services, which we're really excited about. So a lot of council members are reaching out to us to go back to in-person, but we've been working remotely. We've been meeting with constituents via Zoom, via the phone, WhatsApp, basically whatever works for the constituent we'll meet. If it's an applicant who is unable to have access to email and they're not able to print out their application, we'll actually mail the application to them for their signature. And so we've been really innovative in trying to figure out how to navigate the pandemic. And we're happy to say that we're going to continue to use that remote component, even when we go back to in-person services, completely back to in-person services.
That's encouraging. And if others want to chime in, if you could use the raise hand function. Great. Could we unmute Ginia?
Thanks. I was just gonna say IDP's hotline, which has been running for over 20 years, has always been remote. So, we were able to transition pretty seamlessly over the pandemic in terms of being able to receive calls and complete intakes and analysis and work on making referrals and providing support for families.
Thank you. And then I have a question for Melissa Peterson. If we could unmute Melissa. And perhaps
Hello.
also Alexandra from the Safe Passage Project. Could you share a little bit more about how immigrant youth are connected to your organizations?
I can start. So the DOOR is a comprehensive youth development organization. And as part of this larger group of services, we offer legal services. And something that's unique to the DOOR is that we are like a fully integrated group of services. So we work with social workers. Our legal team is primarily focused on immigrant youth, and we serve people who are between the ages of 12 and 24. Specifically my team and through the city funding through iCare, we represent young people who are in active removal proceedings facing deportation.
Thank you.
And Safe Passage is connected to clients in a variety of ways. Word of mouth, certainly. We're on a variety of referral lists. So as immigration court opened back up, immigration judges hand out lists of pro bono legal services, and we're on that list. We're also connected through the federal government. So, as kids, when young people cross the US-Mexico border and they're unaccompanied, they're processed in a certain way. So they generally spend a period of time in the custody of the Office of Refugee Resettlement. And as that office releases those young people from group homes or foster homes to family members to care for them, they alert some number of legal services providers in the location where the child is going. And so Safe Passage receives referrals directly from the government when we learn that a child is arriving in New York City.
Thank you.
And I will say that we've completely pivoted to online intakes during the pandemic, which I was surprised that it actually worked pretty seamlessly, but it works for our clients specifically because they don't have to take time off school. If they have working parents or their caretakers don't have to make it to our physical offices, we can do this all virtually. And we screened about 330 children over the last year using that method.
Thank you for that. And if we could unmute Melissa one more time.
Hi, thank you. So yes, I just wanted to add that during the pandemic, I think we did see a decrease in the amount of usual walk-ins that we would get, because through the DOOR, we intake a lot of young people just from being members of the DOOR and walking through and from other members. But we do receive referrals from other organizations, and we did a lot of outreach for that over the pandemic. And as we see that the city has opened up a little bit, we're getting more people in person, and those numbers have increased again.
Thank you for that. And just 2 comments. Thank you, Mario, for just sharing more broadly about our city's approach to serving refugees. Deeply committed to that as the chair of the Immigration Committee. So thank you for doing all that you are in the capacity within Catholic Charities. And then Ali, absolutely co-sign making sure that our undocumented neighbors are not further burdened by surveillance mechanisms, and that there aren't any micro opportunities to surveil our communities within the IDNYC project and program. So I co-sign that effort with you, and look forward to making sure that we double down when the time comes. Bonnie, we can move on to the next panel.
Thank you, Chair, and thank you to this whole panel for their testimony. We're now going to be moving on to our next public panel. In order, I'll be calling on Rex Chen, followed by Jody Zeismer, followed by Terry Lawson, followed by Victoria Roseman, followed by Catherine Barenboim, followed by Mia Soto. Rex Chen, you may begin your testimony as soon as the sergeant cues you.
Time starts now.
Good afternoon. I'm Rex Chen. My pronouns are he, him. I'm the Immigration Director at Legal Services NYC. We receive Immigrant Opportunities Initiative funding, and that helps our team give immigration legal services to households that had over 25,000 people a year. I'm going to cover 3 quick points about our immigration work. So first of all, immigration cases are taking longer. As Alex Rizzio mentioned, it's more difficult to close out our cases. Hearings are often postponed. Others require preparing for video hearings for immigration court, and it's harder for clients to prepare cases during the pandemic. My second point is that we see that there are even more needs for social work support than before. Thank you for the City Council helping to fund through IOI social workers to help especially with children's immigration cases. More funding for social workers would help adults and families address their needs, prepare their cases, and really be able to talk more as they need to about their traumatic experiences. A third thing I'll point out is flexibility under IOI. We appreciate the flexibility to adjust the service targets to provide emerging services for emerging immigration needs, like you've heard some of the new needs. I'll make one closing point, and that's how important the Low Wage Workers Initiative funding is. It's helped some of my teammates at LSNYC work with the New York Taxi Workers Alliance to get over 45,000 New York City app-based drivers, Uber and Lyft drivers, the unemployment benefits they deserve from the New York State Department of Labor, and that probably totaled around $30 million. So that LWWI funding provides critical help to low-wage workers in New York City, and many of them are immigrants. Thank you.
Thank you so much for your testimony. I'd like to now welcome Jody Zeismer to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Thank you. My name is Jody Zeismer. I'm the Director of the Immigrant Protection Unit at the New York Legal Assistance Group, or NYLAG. Thank you for this opportunity to testify. Time permitting, I'd like to touch upon 4 points. First, a request for an increase in funding for the Rapid Response Legal Collaborative, which funds legal screenings and representation for immigrant New Yorkers with deportation orders who are detained or at risk of detention and imminent deportation. With an increase in funding to $1 million, the RRLC will be able to continue to respond to emerging crises and issues with immigrants in detention, track and educate the community about changes in law and policy, and hold ICE accountable for releasing non-priority immigrants. My second point is funding for emerging needs and responding to refugee crises. As the chairs and others have mentioned, the recent crises in Afghanistan and Ukraine have resulted in greater immigration needs for people fleeing that crisis. And just to be clear, the Afghans that were brought to the United States were not brought as refugees, but as humanitarian parolees. And all 50,000 plus of those people will still need to resolve their immigration status within the next 2 years when their parole status expires. NYLAG was founded by Soviet refugees and is deeply connected to this community as well. To respond to both crises, we have dedicated programs to help Afghans and Ukrainians through pro bono clinics and programs. We have filed almost 200 parole applications to bring Afghans who are in danger to the United States to be reunited with their families, and we are mentoring asylum cases. We are also screening and advising recently arrived Ukrainians, as well as existing clients and immigrants who have been in the community for years. We seek funding to support this work and prepare for future refugee and immigration crises. We would also like to echo Rex and asking for an increase and renewal of the Low Wage Worker Fund. This will support NYLAG's Employment Law Project, which provides advice and counsel to legal representation for low-wage workers who are victims of discrimination. And finally, and this is mentioned in the written testimony, we seek funding for a caregiver program to start a pilot project to provide legal services to caregivers throughout New York City. Thank you.
Thank you so much for your testimony. I'd like to now welcome Terry Lawson to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good afternoon. My name is Terry Lawson, and I'm the Executive Director of Unlocal, a community-centered nonprofit that provides direct community education, outreach, and legal representation to New York's undocumented immigrant communities. I'm also the co-founder and steering committee member of the Bronx Immigration Partnership. Unlocal provides free, high-quality legal services for New York's most vulnerable immigrants. And last year, we handled 1,290 legal matters for those seeking asylum, DACA, SIJ, and much more. Our Queer Immigrant Justice Project, which receives support from the City Council's LGBT caucus, works with the LGBTQIA+ immigrants eligible for asylum. And our KEJIP Ambassador Program provides current and former clients with opportunities to develop leadership skills and connect with other queer identified immigrants. We are also a part of the Rapid Response Legal Collaborative, which Jody just described brilliantly. And we seek $1 million in continued funding for that complex defense work. Those who serve on our team are fighting tirelessly to stop deportations and end ICE detention, where our neighbors' physical and mental health are endangered daily, as so many testified about at last month's hearing. And we applaud the City Council's passage of the resolution in support of the passage of Dignity Not Detention as a critical step to protecting immigrant New Yorkers. Though our rapid response team won the release from ICE detention for a member of the Muslim community in Brooklyn, he continues to feel the full weight of the US government bearing down on him and his family. With RLC funding, we are continuing to work closely with him and his family and many others to fight the relentless tools of surveillance and deportation of the post 9/11 era deployed against him and so many others. Another example of our work, our education and outreach team conducted 70 presentations in 2021, including through a Moya partnership to conduct Know Your Rights presentations across the city and to educate and assist over 200 students for tuition assistance under the New York State DREAM Act. I know at last month's hearing, so many council members talked about wanting to hear about what kind of education and outreach was being done at New York City schools to protect students and their parents, and Unlocal has been doing this work and will continue to do this work with support from the City Council. I'll just end by saying that world events are demonstrating more clearly than ever that migration is a human right, and we support efforts to create greater access to migration for all, having spearheaded a letter last week to the Biden administration signed by 72 organizations in the New York metropolitan area, seeking expansion of TPS protections for countries long ignored, as well as a path to citizenship. Thank you to the council for holding this hearing.
Thank you so much for your testimony. I'd like to now welcome Victoria Roseman to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Thank you so much for this opportunity to testify, and good afternoon, everyone. My name is Victoria Roseman, and I'm a staff attorney at Volunteers of Legal Service, or VOLS, in the Unemployed Workers Project. VOLS was established in 1984, and our purpose is to leverage private attorneys to provide free legal services to low-income New Yorkers to help fill the justice gap. Since the start of the pandemic, VOLS has worked directly with unemployment insurance claimants to fight for their benefits, navigate the Department of Labor systems, and advocate for fair determinations. It is undeniable that immigrant workers kept New York moving forward during the COVID-19 pandemic, yet received little to no assistance themselves when it was needed most. With VOLS's background in the intersection of immigration law and unemployment insurance law, it's our connections to immigrants' rights organizations immigrant workers need and turn to places like VOLS to figure out their options during times of uncertainty. In addition to the legislative exclusion of immigrant workers from unemployment insurance benefits, it's relevant to note that applying for benefits is not immigrant friendly in and of itself. Language access issues plague the Department of Labor's forms, and without in-person locations and little phone support available, it is nearly impossible to reach the Department of Labor for assistance. Questions are framed in a confusing format, even for native English speakers. By law, the Department of Labor's forms are supposed to be translated into other languages, including Spanish, traditional Chinese, Russian, Haitian Creole, Bengali, and Korean. However, many notices and documents are still not available in any language other than English. The Department of Labor does state on its website that other documents can be translated into other languages, but fails to specify which documents and which languages. At VOLS, we do understand the importance of employing trained interpreters and translators as we help limited English proficient workers navigate these systems or troubleshoot when reaching the Department of Labor appears impossible or futile. These language access issues continue post-application as claimants are required to continue certifying for benefits every single week. Without adequate language access measures, the Department of Labor system set up immigrant claimants for failure. VALS, alongside other legal service organizations, has pushed the Department of Labor to engage in more language access programs and to make the entire system more accessible to immigrants, but through FOIL requests and engagement with Department of Labor representatives. In closing, it is essential to fund legal services organizations like VALS, who assist immigrants with not only immigration law issues, but other legal issues like immigrant workers' rights and children's law issues. VALS not only provides direct services to immigrants, but also advocates on a larger scale to the Department of Labor to fix these systems that simply don't work for most claimants, much less immigrant language limited English proficiency claimants. It's imperative that we continue to push for safety nets for immigrant workers who are too often pushed out of our traditional form of relief. Thank you so much.
Thank you for your testimony. I'd like to now welcome Catherine Barenbaum to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good afternoon. My name is Catherine Barenboim, and I am a staff attorney at Legal Information for Families Today, also known as LIFT. Thank you to Chair Hanif and members of the Immigration Committee for the opportunity to testify about the issues facing immigrants with cases in family court. LIFT's mission is to increase access to justice in New York's family court. We combine legal guidance, easy to access technology, and compassionate support to help unrepresented parents and caregivers self-advocate on critical family law issues. We work primarily on cases of child support, custody and visitation, guardianship, and domestic violence. Even before the pandemic, the New York City family courts were already overburdened and under-resourced, hearing over 200,000 cases per year. 80% of litigants come to family court without a lawyer. During the past few years, LIFT has expanded outreach and services to immigrants across New York City. Like all families, immigrants encounter family law issues, but those who are undocumented face increased vulnerability due to their immigration status. Many fear deportation as a result of family court involvement. We work to address this by informing them of their right to file petitions and be heard regardless of immigration status, and to their right to a translator. We offer legal consultations and information through our helplines, both of which have seen a record-breaking demand over the last 2 years. We also help immigrant parents plan ahead by appointing a standby guardian. This is someone who is pre-approved by the parent to take care of their children in the event of the parent's deportation. During the pandemic, the justice gap for unrepresented litigants has been worsened by the inaccessibility of and now delays in the family court. The courts have begun hearing more virtual and hybrid cases, but a significant backlog remains. Unrepresented litigants need support to navigate family court, and undocumented immigrants especially can benefit from compassionate, understanding legal care. Thank you so much for your time. The New York City's Council's support will help LIFT continue to provide the legal advice and information that immigrant families need to advocate for positive outcomes in the family court. Thank you.
Thank you so much for your testimony. I'd like to now welcome Mia Soto to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good afternoon. My name is Mia Soto. I'm the Community Health Justice Organizer at New York Lawyers for the Public Interest, also known as NYLPI. NYLPI is privileged to be part of the City Council's Immigrant Health Initiative, and we really thank you for that support. Today, I'm here to ask the Council to continue their support for renewed funding for the Immigrant Health Initiative, which has really saved lives and improved health across the city of New York. Your funding specifically supports NYLPI's health justice program to continue to fight for racial equity and immigrant justice, particularly through healthcare advocacy, including our ongoing work addressing the human rights crisis in detention and immigration detention, and advocating for the healthcare for all New Yorkers, regardless of their immigration status. Your support has allowed us to continue to provide critical services to immigrant communities all throughout the city in various ways, including legal, medical, and community-driven advocacy. Most importantly, we were able to provide and continue to provide comprehensive screenings and legal representation to individuals, particularly those with serious health emergencies, including holistic support during these challenging times of pandemic. And just last week, we have learned that the City Council has passed resolution number 0066, calling for the New York State to end immigration detention contracts with ICE. And for that, we are really thankful, as that is something that I work on personally. And without the support of the city council, we would not have been able to hold the city accountable towards reducing the physical and emotional harm caused by detention, and ensuring that all immigrants in New York are treated with dignity. We thank you so much for allowing us to present testimony, and we look forward to working with you continuously. And believe healthcare is a human right. Thank you.
Thank you for your testimony. This concludes this panel, so I'm going to turn it to Chair Hanif for any questions or comments.
Thank you all so much. Question for Jody at NILAG. Could you expand on the caregiver program?
Yes, happy to. So there are an estimated 900,000 to 1.3 million family caregivers in New York City, the majority of whom are women over 50. NILAG is seeking to start a pilot project to provide legal services to caregivers through partnerships with caregiver services provided across the city. And as you are probably also aware, many of these caregivers are immigrants themselves or assisting immigrant parent or children in giving care. Our legal health unit would staff this program with on-site clinics at 3 to 4 partner organizations in Brooklyn and receive additional referrals from caregivers through a citywide intake line. Under this model, these sites would cover by a generalist attorney and would serve as a one-stop shop for any sort of legal concerns. This is also this is modeled on a program that we provide for taxi drivers, where we will provide them with legal consultations and referrals for a variety of different issues through a one-stop shop.
And then how much are you asking for the pilot?
We're seeking just $150,000 for this pilot project.
And at this time, are there any other community groups or maybe like organized domestic workers cohorts that you're working with in developing this pilot?
So we work with NYC Health and Hospitals, and already have lawyers who are embedded in many of the area hospitals to provide the same type of comprehensive legal screening and services. And we would work with them, as well as probably with the union that serves these workers, as well as other contact points.
Got it. Thank you so much. And then just wanted to share my gratitude to Terry and the Unlocal team, particularly around the case I think is the one I'm thinking about in the 39th district. This constituent of ours had his citizenship revoked, and it was such a scary time, and just showing the extension of ICE's clause years after an incident. And really for the Muslim community, it is we have been impacted devastatingly by ICE and other interventions of surveillance apparatuses by the police department and other mechanics of the carceral system. And so Terry and your team, really thank you so much for being so diligent in providing care and continued support to this family. And if you'd like to share anything more about the case and just how shocking it was for us to see that citizenship could be revoked. I mean, it was something that I learned. I didn't think I'd see that in this time and day. If you'd like to speak more about the case, would really appreciate it, so that others on this call, my colleagues who are here, could hear.
Yes, thank you for that, Chair Hanif. And while I can't provide too many details about the case, I can just say that it is continuing. ICE is continuing to fight this individual, despite the fact that they've been here for 27 years, despite the fact that they've violated no laws. And this is just what we're seeing across the board. And we are really grateful to the City Council for expanding resources or continuing resources to the Rapid Response Legal Collaborative, because we really need these resources to attack ICE and its tactics on all fronts. You know, it takes a lot of resources to request release, to do federal litigation, to do habeas, to do appeals. And so this work is very complex. And this individual who we got out of detention 2 years ago, we're continuing to fight in immigration court for relief from removal, and so that he can just continue to be a lawful permanent resident, which ICE is intent on stripping from him through no fault of his own.
Thank you, Terry. Bonnie, we can move on to the next panel.
Thank you, Chair, and thank you to this whole panel for your testimony. We'll now be moving on to our next public panel. In order, I'll be calling on Ira Yankwit, followed by Antonia, followed by Jeffrey Lau, followed by Julie Quintone, followed by Lena Cohen, followed by Idenis Alba. Ira Yankwit, you may begin your testimony as soon as the sergeant cues you.
Starts now.
Thank you, Chair Hanif, for the opportunity to testify. My name is Ira Yankwit, and I'm the Executive Director of the Literacy Assistance Center. I'm also a proud member of the New York City Coalition for Adult Literacy. Currently, there are more than 2.2 million adults in New York City with limited English proficiency or who lack a high school diploma. The majority are women and people of color. Over 75% are immigrants, including many who are undocumented. Others are BIPOC who were born in the US and underserved by the public school system. When it comes to funding for adult literacy education, there are three main issues. First, combined city and state funding is so limited that fewer than 4% of the 2.2 million adults who could benefit from adult basic education, high school equivalency, or English language classes are able to access seats in any given year. Second, the level of investment per student is so low that programs are unable to provide the full range of support, services, and resources that students need and deserve. Third, funding places such an emphasis on increasing test scores, accruing credentials, and achieving workforce outcomes that it fails to recognize and honor the full breadth of students' goals and the myriad ways that programs work to build the collective power of individuals, families, and communities. Last year, the City Council made great strides in addressing these issues by pushing then Mayor de Blasio to baseline $8 million in year-to-year funding for adult literacy education, creating a total of $13.5 million in baseline funds, and by allocating $2.5 million of council discretionary funding to a pilot project that provided 20 programs with additional funds to invest in full-time teachers, counselors, expanded support services, and upgrades to technology. The pilot also recognized and encouraged a broader range of outcomes, including support for health literacy, financial literacy, immigrant and workers' rights, housing advocacy, culturally responsive education, and student leadership development. So what do we need to do now? First, the city must maintain the $13.5 million in previously baseline funds and increase the baseline funding by an additional $13.5 million in order to double the level of investment per student in the upcoming DYCD RFP. Second, the council should extend the adult literacy pilot project for a second year and expand it to $5 million to continue to support the 20 programs currently funded, as well as to include an additional 20 programs. And finally, the council should renew the $4 million of council adult literacy discretionary funding to continue to provide for program sustainability. Thank you, and I'd be happy to address the discrepancy between the council pilot and the DYCD pilot in question and answer.
Thank you so much for your testimony. I'd like to now welcome Antonia to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good afternoon, everyone. Thank you for inviting me. My name is Antonia Bernal. I studied English in Literacy Partners program. I was born in Mexico. 5 years ago, I came to the United States in search of opportunities and security. When I arrived in this country, I arrived full of dreams. I never imagined that the country of the dreams was so hard, because life in the United States is very hard for immigrants. That's inexperience for brave people. For my family and friends, I started working as a housekeeper. I'm not ashamed to say it, but I couldn't get a better job because I didn't know English or could ask for a better salary because I didn't know how. I felt inside a cave trapped with change, which didn't allow me to have something better. I was working full time and I didn't really have time to study. When my daughter was born, I felt frustrated because I didn't understand the doctors and the hospitals, and I was afraid to go to my daughter on appointments. I never imagined that the literacy partners would call me to offer me English classes, and I accepted because the main benefit was taking classes from home. I couldn't take care of my daughter and study. Also, in the program, they worried about offering me social services. I understood that the person with problems hardly takes advantage of the classes. Then the program sent me the books for my daughter. Now I can read for her with confidence. I feel confidence to show her the word in English. I don't need translate in a doctor. I feel safe taking to a teachers and principal of my daughter's school. I have a beautiful job where I learn every day. Today, I have a very important goal to tell parents about my experience and motivate them to learn English. I have the goal of showing that the United States is the real country of the dreams and that by
I'm
studying
expired.
English, they can be achieved. Thank you for the opportunity because this money can help someone like me. It's time to change life. Thank you and have a great day.
Thank you so much for your testimony. I'd like to now welcome Jeffrey Lau to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Thank you, Chair Hanif, for this opportunity to testify today. My name is Jeffrey Lau. I'm the Program Director of the Adult Literacy Program at the Chinese American Planning Council. Like so many adult literacy programs throughout the city, CPC relies on city funding to provide quality programming to our communities. I urge the city to continue funding adult literacy programs and continue the Adult Literacy Pilot Program Initiative. At CPC, this funding opens the door to about 600 immigrant ESL students seeking free English classes every year. It has also meant providing much needed wraparound services to our students. For example, throughout this pandemic, students have received up-to-date information on COVID-19 testing sites and vaccination centers. Students learn digital literacy skills to help their children with remote learning. They learn American civics, how to register to vote, and what ranked choice voting is. Students learn about healthcare assistance and, if needed, receive services for domestic violence. Classrooms provide information regarding rental and food assistance. And as Asian hate crimes ravage our communities, students are learning to recognize discrimination, racism, and how to report crimes to authorities. Investing in our communities works. However, at the current cost per student rate, adult literacy programs citywide have struggled to maintain the costs for services and staffing needed. The Adult Literacy Pilot Project Initiative attempted to answer the question of what a fully funded adult literacy program can provide our communities. CPC is one of the recipients of the pilot initiative. Even though only a fraction of the originally asked amount was received, this recently enacted addition means that we've been able to triple the outreach and wraparound services to our students. This means more hours are dedicated to our students seeking childcare, senior care, housing, food assistance, insurance, college access, and workforce counseling. Modernizing aging technological and digital infrastructure has allowed students to access our classrooms remotely and learn digital literacy skills needed to remain competitive. As our communities rebuild from this pandemic, I urge the continued funding of adult literacy programs. Schools are often the heart of the community, and adult literacy classes have stepped up. In order to meet the needs of today and tomorrow, we need to invest. Our students are ready to lend their voices, eager to join the workforce, ready to participate in our city with our vote, and so much more. I thank you for your time.
Thank you so much for your testimony. I'd like to now welcome Julie Quintone to testify. You may begin as soon as the sergeant cues you.
The time starts now.
Thanks so much. Good afternoon. My name is Julie Quinton. I direct adult literacy programs at Make the Road New York, an organization of over 25,000 members dedicated to social transformation through education, survival services, community organizing, and policy change. Thank you, Councilmember Hanif, and everyone else for the opportunity to speak with you. And thank you, everyone who's still on from earlier. It's been a truly inspiring day, seriously. Adult literacy is a critical part of Make the Road's vision for how to make New York an equitable and just city. Every day we leverage all the power we have to push back and creatively try to address the myriad challenges facing immigrant communities in which we are rooted. Our members and students are grappling with a massive housing crisis, unemployment and worker exploitation, COVID recovery / huge health disparities, a school to prison pipeline that's still in place, and challenges accessing immigrant legal services. And on top of that, 2.2 million, as Ira said, almost 25% of our population lack English proficiency or a diploma. You all represent the most progressive city council that we have seen in many years. We really want to work with you to ensure that our city's adult literacy budget addresses the depth of the need as well as the tremendous possibility that comes with funding programs. Adult literacy programs as a right and not a bone to be fought over by those of us who some would prefer to keep silent or unempowered or in the shadows. Investments that lead to the development of English language, literacy, and numeracy and high school diplomas have a transformative effect, as everyone has been saying, on every aspect of public life for our community members. And literacy skills are the most permanent language access tools there are, allowing immigrants who have them to more effectively access housing, health, legal, and transportation services. Funding literacy well will create conditions where immigrants are more able to vote under new laws, access jobs, or push back against wage theft. And most importantly, especially in community-based programs, we are excellently positioned to be frontline spaces for Know Your Rights health, education, and service info sharing, and doors to community engagement and organizing. Thank you in advance for your work with us, and look forward to working with you this budget season. Thanks a lot.
Thank you so much for your testimony. I'd like to now welcome Lena Cohen to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Thank you so much, Chair Hanif, and to the members of the City Council for taking this hearing. My name is Lena Cohen. I represent United Neighborhood Houses. We're a policy and social change organization of 45 settlement houses across the state. And at UNH, we advocate for an education system that provides high quality, comprehensive, and accessible adult literacy for all New Yorkers in need. And currently there's about 15,000 New Yorkers enrolled in city funded programs. And as my colleagues just pointed out, we're only able to serve a fraction of the rest of our adults who are in need. And so today my testimony really focuses on 3 of our main budget asks for adult literacy. First, we are really eager to grow the City Council's adult literacy pilot project to $5 million. And that would allow us to fund up to 40 programs in this pilot, and it would address some of those additional costs that, again, my colleagues outlined, such as teacher salaries, additional case management services, and just overall program sustainability. And then the second budget ask is really to the council to renew its continued $4 million in discretionary funding, which does allow about 40 programs each year to keep their doors open. And then lastly, we really are in a critical year regarding what the mayor can do with adult literacy funding. We're asking him to double the baseline, which would bring it to $27 million. And that would increase per student funding rates before DYCD issues the next RFP, which we anticipate at the end of this calendar year. Adult literacy is definitely about more than just learning English. It's also a vehicle for civic engagement. And so, for example, adult literacy classes are an ideal space to talk about the new Our City, Our Vote legislation. UNH is a proud co-lead of the Our City, Our Vote work. And we want to just acknowledge the historic moment we're in right now to implement this legislation successfully. And so with that, UNH recommends a $25 million. Thank you. UNH recommends a $25 million City Council initiative to support community-based outreach to newly enfranchised voters under this bill, including voter education, registration, and get out the vote activities. Thank you so much for the time today, and I look forward to working with you.
Thank you so much for your testimony. I'd like to now welcome Denise Alba to testify. You may begin your testimony as soon as the sergeant cues you.
Time starts now.
Good afternoon, everyone. My name is Denise Alba. I am a student in the ESL program at Lehman College. I would like to take this opportunity to thank you for supporting adult learning centers. It is important for me and my family, for it represents a step towards our future. I would like to begin with some of my background history. I am a single mother and I've been in the United States for 3 years. At first, I felt insecure because I couldn't communicate and didn't understand anything in English. I couldn't understand my children's homework and I couldn't help them out. With what I have learned so far, I feel more confident when talking to someone or when I am in a meeting with the children's school or doctors. The programs has also served as support for my college and for me in these times of pandemic. Well, it made us more united and we moved to learn virtually. My expectation with the program is to be able to go to the college and consequently have a stable economic environment with which I can provide a better future for my children. Infinite thanks for your contribution for the development of others. Thank you so much.
Thank you so much for your testimony. I'm going to turn it to Chair Hanif as this panel is complete.
Thank you so much, Bonnie. Just want to first thank Antonia and Idanis for your testimonies. Appreciate hearing how effective and life-saving adult literacy programming has been to your lives and for your families. I'd like to first turn to Ira, and if others on this panel could just use the raise hand function, because I've got some just other questions that I think I'd love to hear from all. Ira, could you address the discrepancy between DYCD and the MOIA budgets on adult literacy programming?
Are you referring to the different pilot projects?
Correct.
Yeah. So as we mentioned, and as you know, last year, the council pushed the mayor to baseline $8 million in what had previously been year-to-year funding, in addition to the council creating this historic pilot project. The announcements about who was awarded funding for the pilot project weren't made until the late fall. So we knew that it was moving forward, but it was somewhat dormant for those first few months of the fiscal year. At the same time, because DYCD itself recognizes the need not just to increase funding to expand services beyond that 4%, but also to make greater investments in resources for students, one of the things they were able to do this year with the $8 million that was baseline, and some of my colleagues here can talk about this because they've benefited from this, is that they actually provided funding for case managers in all of their contracted programs. And they referred to this as a pilot as well. So we learned that the council was moving forward with the pilot for $2.5 million. We learned that there was $8 million baseline. Over the summer, DYCD announced that as part of that baseline funding, it would invest in case managers for programs. It referred to it as a pilot. And then the city council pilot was initiated in the fall. So I suspect, although I don't have this confirmed, that $1.7 million that they are cutting from the baseline funding, my guess is that it corresponds to the amount that they're investing in case managers, but that's speculation on my part. But that's the pilot that they're talking about.
Got it. Thank you for that. Next, I'd like to go to Jeffrey. In the conversation we had several weeks ago with the Adult Literacy Network, you articulated how adult literacy programming were outlets and spaces, particularly for our Asian immigrant students, in articulating or being able to really put into words their fears in the wake of anti-Asian violence. Could you speak on that?
Yeah, thank you for this opportunity to talk about that. Yeah, our spaces have been one of the consistent things that happened through the COVID shutdown was that we were able to keep our classes together. So there was this this community that was built out where folks can get information, whether that was about COVID and the symptoms and the testing, but as well as the violence that was happening around the city. Our students were given the ability to express those fears, right? And those fears are real. Students are still continuing to talk about how they are afraid to leave their homes. They are afraid to come into in-person classes. Just for context, one of our classrooms is right next door to where the murder happened in Chinatown recently. Our classes meet right next door. And our students walk past the memorial, the makeshift memorial site that is wrapped around the tree directly in front of the entrance every single day. And they see that. Students are learning how to recognize racism. I mean, I did have a student, I think she expressed it probably in the clearest terms was, how do I even recognize racism if I can't even speak English? right? How do I learn how to even protect myself without learning how to speak English? That's what this is meant. It's meant being able to protect themselves, being able to defend themselves with language and with these skills. Students are learning how to recognize the racism and discrimination that they might be hearing on the street and can take necessary actions if needed. They're learning how to fill out a police report if needed, right? This is just one example of so much good that adult literacy classes have provided throughout the city. Just that place to find the assistance needed. And of course, it goes more than that, right? Like, so if students need food access or rental assistance or domestic violence, again, our classes have been an outlet for that. We have had students in our classroom talk about domestic violence, receive the help, and through our program, find shelter, find rental assistance, find legal assistance, find food assistance. And we're really just there. It's a community.
And could you share if there's like particular outside of just students, feeling safe, to share what's happening with them or what's on their mind in this community? Is there curriculum that's being incorporated into the course around anti-Asian violence or Asian history in our state?
Yeah, all of that is built in. We do have a civics curriculum in CPC, but also we do invite folks outside as well. I did hear, and I was glad to hear that you brought this up through the Know Your Rights workshops. We brought those into our classrooms as well. And just within our agency, I know, I was trying to get the exact numbers. I only got ballpark numbers, but we got about 540 community members were reached through that, where students were learning about their rights, about how to protect themselves, about students and community members within our agency. It's not just students, it's everybody who comes to our agencies, did receive, whether that be like the whistles in case, like for seniors who, if they were ever in trouble, or self-defense, like if they were interested in learning about self-defense, we were giving them information on how to get that. It was, I think that answers your question. I'm not sure.
Absolutely. Yeah. I mean, would the groups on here agree that there's more funding needed to really look after particularly our Asian immigrant communities at this time through adult literacy programming?
I would say yes. And I mean, on a typical year, we see about 1,600 folks coming into our doors looking for adult literacy classes. And just by the nature of the funding, we're only able to sit about 500 or so. That puts so many folks on waiting lists, they're putting their lives on hold, but they're also, there could be more opportunities that they would be receiving through access of these classes if we would just fund it what it costs to actually fund a program and meet the demand that's there.
And then more broadly, is there like a disaggregated breakdown of which immigrant communities are participating or joining adult literacy programming?
I think I could defer that to one of my colleagues over here.
Sure. Is there anybody who feels comfortable articulating? If you could just use the raise hand function, and then we can. I saw Ira's physical hand go up.
Yeah. So I don't have those figures in front of me, but I know DYCD absolutely has those figures, and it's yeah. And also just to the question that you were just asking and Jeff was just speaking to, I think one of the most powerful things about the pilot project wasn't just that it was increasing funding for additional services, supports, and resources, but that it was recognizing the kind of role that adult literacy programs have the power and possibility to to play, and allowed programs to invest those resources in things like culturally responsive education, student leadership development, more work around workers' rights, immigrant rights, housing rights. So we really, want to continue the pilot, not just to increase the funding as necessary, but also to build out programs' capacity to do more of that essential work. And again, especially with the enfranchisement of so many more New Yorkers now. So, and we'd be happy to talk with you about what kind of programming would look like that really did that more fully.
Awesome, thank you. And then Lena, thank you so much for raising just how critical it is to prioritize implementation of Our City, Our Vote. And this is a question to you and the rest here on the panel. Could you just describe what the civic education portion of your programming has looked like and its reach?
Yeah, absolutely. So with the Our City, Our Vote implementation right now, what we're planning to do is work with our 60 organizations that are signed onto the coalition to break out into 4 committees that will play essential roles, both coordinating with the city's campaign finance board as well as the city's Board of Elections and the Civic Engagement Commission. And so the 4 kind of different buckets of our plan for the next year leading up to the implementation, or like the date that the bill goes active, which is December 9th, 2022. We have a committee that's focused on fundraising, which is actually addressing, or I should say leading the work to present a proposal for a $25 million discretionary initiative. And we envision that rolling out similar to what we saw in the 2020 census, with community-based organizations really taking on the lead, not just being at the table, but having the resources they need to do that voter education and outreach, especially since we know that the Board of Elections isn't mandated to do voter education outreach. That's why, again, we really see ourselves working closely with the Campaign Finance Board. And so while fundraising is a big piece of that, the other 3 areas, the first includes legal. There are 2 lawsuits challenging the legislation itself. However, the city is very much moving forward with the implementation as planned, and so therefore as are we, but we still want to be monitoring the legal case. And so that's one area of our work. But then the 2 really main ones, third would include our community outreach and education. And this is where we've seen just already an incredible intersection with the adult literacy field, for example, just kind of getting the right folks in the door early to start planning program integration and whatnot. And so community outreach is a big one. And then finally, implementation. So that'll be the part where, again, we're working very closely with Campaign Finance Board, but also Board of Elections in their process for developing the municipal voter registration forms, the ballots, and day of election day operations.
Excellent, thank you.
Sorry for the background noise.
Did you want to add on?
Yeah, Councilmember Hanif, I just wanted to add, just make a comment about the earlier item we were discussing, the potential cut to DYCD's use of baseline funding for case management. I have to say, that would be a tragedy. Our case managers are so happy right now, and we're just getting the program running. It's allowing us to have a kind of a case manager to student ratio that is finally robust, that allows kind of preemptive check-ins as opposed to just responding to emergency situations and crisis management. We're going after people, we're helping people to identify needs that they might not have even identified for themselves and make connections in a more holistic way. Frankly, if we were able to, it's not really an either or situation. If we were able to preserve that funding and preserve the pilot money could, of course, be focused in other directions, perhaps paying part-time teachers to become full-time teachers or at a better rate, or digging in on curriculum development that can be shared across the network. I feel like I just want to put that out there early. I don't really understand how that's all going to play out. And it sounds like there's a lot of balls in the air in terms of how we're going to be talking about this potential cut, but I just want to put in a plug. That was a smart move on DYCD's part. They were actually advocating to fund the positions at a decent rate as well. I think it was just rolled out very late at a time when programs were already quite fragile and challenged. But I really feel like we can talk more about it, but I just want to put in a plug for that particular piece of the pie and how it's working right now for programs.
Yeah, I appreciate that. I'll certainly be investigating as well. And I see Jeffrey's hand up.
Thank you, Julie. I definitely want to echo that cuts would be very destabilizing, as it did take it took a while for the money to finally come in, and it took us even more time to get the ball rolling. So cutting these pilot programs now, when we've really only had about 6 months less to try and institute what was supposed to be a year's plan, would be very destabilizing. I also want to echo that part-time instructors are would very much appreciate some stability in hours, right? We're talking about 3-month blocks and then maybe a month off and then another 3 months blocks, and folks still need to pay their rent in New York City. So just keeping that there and in place, and thinking about the staff would be very helpful as well.
Thank you. And then one final question for this panel. I'd like to know a little bit more about the just profile of the teachers and the pipeline to becoming an adult literacy educator. At this time, Ira, this is something we've talked about, really moving from a community-centered approach to training folks in our neighborhoods, bilingual in the languages they're serving or the population they're serving alongside English. Would love to just learn a little bit more about our educators.
Absolutely. And I think, Jeff and Julie can speak directly to the teachers in their program. So I think are probably representative of who we're seeing in the field. What I can say is that in doing this for now going on 30 years, there has been a real demographic shift among the teachers in programs at the same time as there's been greater level of professionalization. So certainly the field looks very different than it did in the 90s. Both the teachers and more the leaders of programs are actually from the communities that they're serving. They come with the same lived experience as the students that they're working with. And there's been more of an investment in professional development. And as the organization that is very gratefully funded to provide professional development to the DYCD funded CBOs, I can just give an example that for years we had a certificate program that taught people to be teachers of English to immigrants. But it was tuition-based because we didn't have the funding for it. And so we tended to find people who were middle class, upper middle class, skewed whiter, who were able to participate. DYCD, when we got expanded funding, allowed us to provide that course free of charge to those who were interested in taking it, and the demographics changed dramatically. And what we started to see more of were immigrants themselves, who sometimes at the beginning of their career path, sometimes in the middle, sometimes at the end of their career path, who were interested in giving back to their community in the same way that they were able to learn English in their community-based organization. So the demographics have really shifted with that investment in professional development. So we've seen more staff more representative of the communities, and at the same time a greater professionalization of those staff members to serve their communities.
I think Ira just said it all. I can speak that it does range as well. There are some folks who, well, they're all driven with this need to just be an active member in their community and support in the ways that they know how to. Right. I can't say it any better with their professionalism than the way Ira just put it. I was also once an instructor, and the reason why I came into this field is because I know it works. My mother also needed to learn English through a nonprofit, and she also received these services many years ago before I was born. I know it works, and you hear all these stories of why teachers want to work in nonprofits, want to work with their communities, and chose this field.
Thank you.
I would just put in a huge plug for whatever we can do to continue to try to fund and support the training programs like Ira's described, even when we're in a hiring position and we want to hire bilingual folks, and we want to hire folks from the community. Sometimes if the training's not there, it's really not good for the students. And it's hard, I think, for programs on our own, even if we want to try to create internal pipelines of training, to do that on top of all the other work. So to have an external provider who works with us closely and can partner and can have folks do training, run training classes, get their feet wet in our programs, it's just better for everyone concerned, because not everybody's being stretched too thin to do more than they are best suited to do. It's like drawing from people's best skills, and then we're so happy to receive them once they've had the training. So it'll be great to see that continue to grow. I'm glad you're thinking about it. I think if we can pay folks, there's also all the issues of pay, which means that if people come into the field and they already have debt from previous education or family debt, there are things that it's an extremely moving and important job. But if there's incredible economic burdens, we're trying to fight that from the kind of teacher salary angle. And I think that'll be longer term one of our fights as well. It's been inspiring to see that get some traction in council for childcare workers. If we can start to expand it to include adult literacy workers longer term, we'd be thrilled. It's just we haven't been able to prioritize that right now because we've just been trying to save our necks every year.
Totally.
So,
no, I understand.
you got
can
me.
count on my support for this. This is something I've bugged Ira about, because just looking at my own district, we haven't been able to have sustaining programming. And like for communities where entire classrooms could be one singular community, it is essential for us to have educators from that community to be able to speak the language of the students while also being able to provide material in English and the other language. And we can be innovative about this. We can be experimental about this. So I'm looking forward to prioritizing this. Bonnie, we can move on to the next panel. Thank you all so much.
Thank you. Take care.
Thank you, Chair, and thank you to this whole panel for their testimony. We'll be moving on to our next public panel. In order, I'll be calling on Theodore Moore, followed by Maimuna Di, followed by Sylvia Peng, followed by Jihei Fisher, followed by Kenny Minaya, followed by Lakshmi Munganathan, followed by Adama Ba. Theodore Moore, you may begin your testimony as soon as the sergeant cues you.
Your time starts now.
Okay, good. Is it evening now? I think it's evening. So just wanted to speak quickly on some of the initiatives of the New York Immigration Coalition, and then ditto a lot of the work that the previous panelists spoke on. So my name is Theodore Moore. I'm the interim vice president of policy at the New York Immigration Coalition. And I want to say that the city council took an important step towards New York City really being a true representative democracy with the passage of the Our City, Our Vote legislation, Intro 1867, that was passed on December 9th of last year and adopted on January 9th of this year. So in January of this year, over 800,000 individuals with green cards and those authorized to work will become eligible to vote. Those same individuals will be able to vote depending on when the first election is held in January of 2023 of next year. This city council's investment in the implementation of this law will be crucial to the initial and future success of municipal voting in New York City. Not only that, but it will serve as a blueprint for other municipalities around the state and around the country that are really going to be following what this council did and pass similar legislation. Because of these factors, there's a huge need and opportunity to ensure that organizations are funded sufficiently to perform duties at an adequate and necessary level. Because of this, the NYIC is proposing a couple things. One is the creation of a $25 million fund that is distributed to CBOs, particularly the Our City, Our Vote Coalition, to conduct truly expansive citywide voter registration, voter education, and get out the vote efforts. Secondly, an increase in the overall budgets of every city agency, department, and office that will be involved in the implementation of municipal voting. And that includes a $25 million increase to the previous budget to the Board of Elections, a 10% increase to the budget of the Civic Engagement Commission, Campaign Finance Board, and the Mayor's Office of Immigrant Affairs, and a 5% increase to the previous budget of DYCD. Thank you.
Thank you so much for your testimony. I'd like to now welcome Maimuna Di to testify. You may begin when the sergeant cues you.
Time starts now.
Good afternoon, members of the Immigration Committee and Council Member Hanif. My name is Maimuna J, Program Manager at African Communities Together, also known as ACT. At ACT, I lead our Community Interpreter Program and supervise the development of our African Language Services Worker Cooperative. I am before here today to discuss the importance of funding programs that will help immigrant New Yorkers to receive interpretation in their language at the point of service. Language barriers are particularly significant for communities that speak languages of limited diffusion to LLDs. LLDs include most African languages, many Asian languages, and indigenous Latin American languages. Speakers of LLDs are often hard to reach communities who are most disconnected from immigration services and outreach. During the pandemic, ACT ACT conducted a survey to measure the impact of COVID within the African community. We were able to survey over 1,475 community members. And the results of the question, did you receive any information from the government about the coronavirus, either health information or resources like unemployment in your language? Over 65% said no. During the height of this life-threatening pandemic, where thousands of people lost their lives, if no other time made language access a priority, this should serve as an example as to why this is extremely necessary. ACT is proud to work in partnership with, through the Language Access Collaborative, with language access champions like Asian American Federation, MASA, NYIC, and at the state level, Empire Justice Center. Our collaborative is proposing two critical initiatives to lower the barriers for immigrants to access services. The first being the creation of a community interpreter banks, which is a model that the District of Columbia has successfully used since 2007. And it recruits, trains, and dispatches interpreters who provide services free of cost to city agencies and nonprofits. Second being the development of language services worker-owned cooperatives, one for African languages, one for African LLDs, one for Asian LLDs, and one for indigenous Latin American LLDs. These will be community-based agencies that will build a pipeline of trained language services professionals while creating skilled employment and business ownership opportunities for New York immigrants. And these co-ops will also help meet the demand for high-quality language services in the courts, city agencies, educational institutions, healthcare, and the private sector. As the city decides on the budget for the coming fiscal year, we urge you all, members of this committee, to continue in your advocacy to fund language access expansion and to work with our collaborative by allocating $3 million to fund these two programs, which will help address the needs for New York's most vulnerable populations to be able to access vital city services in their language. Thank you for your valuable time and consideration in implementing our recommendation.
Thank you so much for your testimony. I'd like to now welcome Sylvia Peng to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Sorry, I wasn't able to unmute, but I want to thank the City Council members for giving Asian American Federation the opportunity to provide testimony at this year's budget hearing. I'm Sylvia Peng, and I'm the Immigrant Community Navigator at the Asian American Federation. AAF represents the collective voice of more than 70 member nonprofits serving 1.3 million Asian New Yorkers. While leading the AAF citywide immigrant integration program, I worked closely with our partners to provide services to low-income Asian immigrants. And here's what we saw. Because of our wide cultural and language diversity, our Asian immigrants are often the last to know about key information. Language is a central barrier to access, but it is not the only barrier. Our immigrants also struggle with the digital divide, financial struggles, mistrust, or just unfamiliarity with city resources and missions, and barriers created by legal statuses. During the pandemic, our immigrants struggled to keep up with the changing COVID policies, recovery assistance, and legal processes. Technical gaps such as webinars without a in-language pre-registration form, applications with a web portal only process, and hotlines without Asian language speaking operators all can create a gap within the service that's supposed to be language accessible. So as a result, our CBO partners became the Trusted Center, and the Trusted Center stepped in to offer wraparound services for legal support, food insecurity, and recovery application assistance, just to list a few. These case management and bridge services, unfortunately, are often invisible labor that are not funded by the city, leading to bilingual staff departures and burnout. We're asking the city to continue to invest in building the capacity of Asian CBOs, as we are one of the city's greatest asset to immigrant integration for such a diverse community. We need funding so that case management and outreach efforts can be fairly and sustainably compensated. We're also asking, similar to the other panelists on this panel, for City Council to commit a community legal interpretation bank and to a workers co-op that will focus on recruiting, training, and dispatching of qualified interpreters. The city also has to make sure that in this budget, it includes funding such that the local law 30 is fully and consistently implemented across city agencies. Thank you very much.
Thank you so much for your testimony. I'd like to now welcome Jihei Fisher to testify. You may begin as soon as the sergeant cues you.
The time starts now.
Aloha and good evening. I would like to begin by thanking Chairperson Hanif, Committee on Immigration, for the opportunity to testify today. My name is Eric Agarijo, and I'll be speaking on behalf of Jihei Fisher, Executive Director for the Korean American Family Service Center. For over 33 years, KFSC has provided direct services to immigrant survivors and their children who are affected by gender-based violence, domestic violence, and all forms of violence. KFSC provides comprehensive services for clients, including counseling services, case management, transitional housing, economic empowerment programs, after-school programs, and other wraparound services. All of our programs and services are offered in a culturally and linguistically appropriate setting, which operate year-round, and our 24/7 bilingual hotline and emergency shelter are in operation 24 hours a day, 7 days a week. A culturally sensitive and linguistically appropriate crisis intervention and counseling service support more than 2,500 individuals annually. 98% of our clients are immigrants, and 100% of our staff members are immigrants themselves or children of immigrant background. Over 95% of our clients' first language is not English and come from low-income backgrounds or live under the poverty line. Many of our survivors are unfortunately undocumented, uninsured, and now unemployed. We have expanded and launched new initiatives to meet the heightened need for domestic violence case management support, mental health services, academic enrichment for youth, cash assistance, access to health insurance, food security, and much more. Many of our survivors are undocumented and excluded from accessing unemployment insurance and all other income supports. Yet the needs of the community are constantly overlooked and uncounted. They lost financial means, some temporarily, others permanently, resulting in a loss of livelihood and unable to support themselves and their children while facing the layered trauma of gender-based violence and domestic violence. Many in our community and their loved ones have
expired.
Let me wrap up in this note. Many in our community and their loved ones have contracted the virus and died while facing a spike in anti-Asian violence and racism, all while receiving the essential support and services they need. Without financial support, our immigrant survivors can't afford food, rent, basic necessities, personal protective equipment and supplies, medical care, or even basic living expenses, phone, internet, utility bills, etc. To address these barriers and challenges, KFSC, along with a partnering community-based organization, requests that the city ensure that all legislation and funding addresses the unique and multi-layered challenges, support our comprehensive programs to the Asian American and Pacific Islander community. KFSC looks forward to working with this council, the committee, and our community partners to address the continued services, For our immigrant survivors and their children, we thank this council and committee and for the opportunity to testify this evening. Thank you.
Thank you so much for your testimony. I'd like to now welcome Kenny Minaya to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Good evening, everyone. Chair Hanif, members of the committee, and my colleagues doing all this great work across the city. Thank you for your testimony. My name is Kenny Minaya. I am Director of Government Affairs at Make the Road New York. And I join my colleagues in calling on the council to hold the administration accountable here, ensure that we continue to fund adult literacy, increasing that baseline from 13.5 million to 27 million. We asked the council to double its funding for the adult literacy pilot project to 5 million and to continue and renew the amount allocated to the adult literacy initiative to the tune of $4 million. Wanted to talk a little bit about our employment legal services. There's two specific sources of funding that we depend on as members of the SILEC Coalition to deliver such services. The first is funded by HRA. That's the Low Wage Worker Initiative. As of last week's hearing, March 9th, where HRA testified before their committee of jurisdiction, still uncertain whether HRA is going to extend that contract for fiscal year 23. That's particularly for the Low Wage Worker Initiative. I know council members Ressler and Krishnan were concerned about that. Would ask members of the Committee on Immigration to join us in advocating for that funding to be extended. There's a council initiative, Low Wage Worker Support. Funding for that initiative has been trending downward over the last several fiscal years. We would love council to restore and actually increase the amount allocated there to $1 million. That funding goes to help connect workers to employment legal services. I join my colleagues on the immigration legal services front in calling for a continued baselining nationally, an increase in the amount allocated to the Rapid Response Legal Collaborative to $1 million. And lastly, on the health access front, we thank council for their previous support and ask that council continue its $2 million allocation for the Immigrant Health Initiative. Thank you.
Thank you so much for your testimony. I'd like to now welcome Lakshmi Samunganathan to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Good evening, everyone. Thank you, Chairwoman Hanif and the esteemed members of the Committee on Immigration for holding this important hearing and giving us the opportunity to submit testimony. My name is Lakshmi Shamaganathan, and I'm the Budget Policy Coordinator for the Coalition for Asian American Children and Families, CACF. For more than 35 years now, CACF has been the nation's only Pan-Asian children and families advocacy organization, and we lead the fight for improved and equitable policies, systems, services, and funding to support our most marginalized community members in need. CACF also leads the 18% and Growing campaign, which brings together 60 AAPI-led and serving organizations across all 5 boroughs of New York City to protect the needs of our most vulnerable community members by fighting for a fair, inclusive, and equitable New York City budget. Our AAPI community in New York is heavily immigrant in nature. 78% of AAPI New Yorkers are actually foreign-born. Our AAPI community is also by percentage the fastest growing racial population in New York City. We now make up 18% of our population, hence our campaign's name. Despite our community's expansive growth and development, current levels of public funding for the AAPI community remain disproportionate to our community's needs. For example, last fiscal year, our organizations received less than 4.7% of city council funding and less than 1.5% of social service contract dollars. This past 2 years have also been an exceptionally painful time for our community members, as COVID-19 and the rise in anti-Asian violence has left a devastating impact on AAPI New Yorkers, but also exacerbated and illuminated systemic inequities that were existing in our communities far before the pandemic. For example, more than 1 in 4 AAPI immigrants in New York City live below the poverty line, but at the start of the pandemic, AAPI New Yorkers also experienced the largest rate of joblessness, with roughly 26% of our community being unemployed as of May 2020. Asian Americans in New York City were also 2 times more likely to test positive for COVID-19 compared to their white counterparts, And last year, there were over 9,000 reported incidents of anti-Asian violence in New York City, which was the highest reported rates of incidents of all cities in the US. So I'm here today to call on the New York City Council to enhance the AAPI Community Support Initiative to provide support to more than 50 AAPI-led and serving community-based organizations across New York City who are providing vital, culturally relevant, and language-accessible social services and programming to our community members during this time when we need to recover and heal. And we need our community networks of support that have been lifelines for our community members long before the pandemic, but especially now. So thank you to the committee, and we look forward to continuing to partner together.
Thank you so much for your testimony. I'd like to now welcome Adama Ba to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Hello, everyone. My name is Adama Ba. I'm here to testify as someone who's formerly undocumented and now supports other immigrants in trying to navigate a system that's not created for us. I can go on forever on many concerns and issues, but I've chosen to speak on three. That is the expanding of Action NYC Legal Service, IDNYC, and language access. Immigrants have different statuses, but trying to get legal help is truly hard. Because of lack of legal assistance, immigrants are being taken advantage by paid attorneys. Due to fear of retaliation, immigrants are afraid to report an attorney who has taken advantage and taken thousands off their hands. As for IDNYC, the program is excellent, but accessing those services for some have generally been hard, from getting appointments or having a number of points to receive the IDNYC card. The program doesn't factor into the different scenarios of immigrants and how they arrive. The IDNYC card needs to be expanded and enforced where it can be accepted. We need to address and modify the list to meet the community needs. As for language access, this can be a translation which needs to be addressed. English classes, ESL classes are hard to register because they provide such a time restriction for immigrants that work under the table in jobs that don't consider or modify their hours to meet their educational or individual needs. Lastly, we can talk and have many discussions about immigrants and their issues we face, but if individuals like myself who have been traumatized, criminalized, simply for wanting a better life, do not have a seat at the table to make a better decisions, we will continue to have a system that fails not just us, but for generations to come. Immigration is not a US or a New York issue, it's a worldwide issue. Thank you.
Thank you so much for your testimony. I'm going to now turn it to Chair Hanif for any questions or comments.
Thank you all so much for your work and advocacy. I have a question for Maimuna. Could you speak a little bit more about the worker cooperative at your organization?
Sure. So currently, African Communities Together is in the incubation process of creating an African language services worker cooperative. So we have recruited and trained workers, interpreters. So initially, we helped them to get tested. So they all needed to go through an English language test.
Did African Communities Together do that, or an outside entity?
African Communities did that. So we received a funding from the WCBDI, which is the workers' cooperative business. So we've been advocating for this for so many years. So when we went and got that funding, we decided to show that this can actually work. So that's the reason why we recruited members in the community who are interested in creating a language worker cooperative. And last summer, we got all of them to be tested in English and also in the language of their choice. And everybody who passed the test, move on to the second stage. And those who didn't pass it, we asked them to retake it for a second time. They were given a second chance to retake those tests. And if they passed the test, then they went through a 60-hour intensive training with an organization that is known for training professional interpreters. So all these people, so we have 12 people who successfully passed the exam, both the language testing and the 60-hour interpreters training, where they learn things like professional ethics of an interpreter, code of standard of being a professional interpreter. And right now we are in the process of launching the interpretation program, the co-op by the summer. So interpreters currently are going to learn about creating a cooperative business, creating their bylaws, things that, how do they manage their back office management when they receive interpretation services and translation services. And then eventually after the co-op launch, we'll also create a language instruction for anybody who wants to learn an African language. And then for new Africans, just like Adama was mentioning earlier, who are new into the country and can't access ESL classes due to their work schedule, we will accommodate ESL classes for those members as well.
That's really, really inspiring, encouraging work. I think worker cooperatives are the way to go about addressing, solving, expanding language access in New York City. So please keep me posted about the launch. I would love to be there with the Immigration Committee. And I'm just really inspired by all the work that has gone into recruiting community members and getting trained and ensuring the success that they pass. How many African languages are covered among the 12?
We have around 10 languages. A lot of people are multilingual speakers. So just the top languages, we have French, Mandingo, Wolof, Fulani, Arabic, just a lot of languages, because a lot of people will speak at least 2 or 3 languages. So initially we just asked them to be tested before funding resources, because those testing needed to be paid. So we covered the English testing and also 1 additional language. And then if we do get funding in the future, they'll be tested in other additional languages, because they speak those languages. And we've been running a community of interpreter program where we have over 90 people who are in that program. And we have like 25 or 30 languages. And we receive a lot of requests from organizations like Take Root Justice, NILAC, the schools such as Columbia, asking us to provide an interpreter for an African language or French and Arabic.
That's excellent. And if you could expand on, oh gosh, I just had another question that slipped my mind. 1 sec. I'll probably have to come back
Sure.
but just really excellent work, really inspired to see how thoughtful your approach has been. And just a better awareness for our city in serving our African communities. So thank you so much. Really serving as an example to, I remember the question. What is the pay scale of interpreters? I mean, one of the biggest issues is, of course we want our city to be language accessible, but oftentimes language access providers are seen as, volunteers and unpaid or very, very low paid, but they are indeed essential workers and should be making a livable wage. So could you speak on the pay scale?
Sure. So we a lot of our members, when we ask them, they used to do interpretation with services like Language Line, and they were only getting paid $25 per hour. And we know Language Line gets at least $80 per hour from the city. So anybody who's using our services, we ask them to pay the interpreter $75 per hour. And if it's an in-person interpretation, they have to be paid a minimum of 2 hours, and everything goes to the interpreter, all that money. And then for translation, it's $100 per page. But then organizations that we have a partnership, such as Take Root Justice and I forgot the other organization, because they provide immigration services free for our community members. For those organizations, if they need interpretation, we ask them to pay the interpreter $50 per hour. But anybody else, it's $75 per hour. We have a minimum of 2 hours payment for in-person interpretation service.
Excellent. Thank you so much. This conversation really made me excited and inspired. So really looking forward to our continued fight for language banks in our city.
Great.
Bonnie,
Thank
we can
you for
move
your
on to
support.
of course, we can move on to the next panel.
Thank you, Chair, and thank you to this panel for their testimony. Next, I'll be calling on the following folks in order. Veronica Piedra Leon, followed by Lihia Gualpa, followed by Nadia Marin Molina, followed by Gail Johnson, followed by Plinio More Duran, followed by Estefania Galvis, followed by Diana Moreno, followed by Yesenia Mata, followed by Magdalena Barbosa. Veronica Piedra Leon, you may begin your testimony as soon as the sergeant cues you.
Time starts now.
Good evening, Councilwoman Hanif. It is a pleasure for us to speak here at the at the Immigration Committee hearing. I'm the coordinator for the Day Labor Coalition, a coalition that is comprised of New Immigrant Community Empowerment, Workers' Justice Project, La Colmena, Catholic Charities, and Northern Manhattan Coalition for Immigrant Rights. We serve 100,000 day laborers, and we provide key services to this population. We provide job dispatching, workers' rights information sessions, wage step support, referral to critical services, and workforce development and training. This is all done through the Day Labor Workforce Initiative. This year, we're asking the City Council to increase our current funding to $5.4 million. This is a 1.6 increase, and this increase will help us to sustain the work that we have done this past 2 years. Since the onset of the COVID-19 pandemic, we have now closed our doors. We have provided critical services that go beyond the scope of work of this initiative. We provide workforce development and training to construction workers through not only the Day Labor Workforce Initiative, but through the construction site safety training. Training saves lives. This training comes through Local Law 196. At this point, the funding that was allocated through Local Law 196 will be renewed for an additional year. But as we know, recent death of a worker, training needs to continue, and training needs to be provided to our communities in a language of their own. We need to be able to continue to provide this training and provide not only construction site safety training, but other training that allows for workers to be on the construction sites. We serve not only the construction industry, but other industries. And among these 5 organizations, we have seen and touched the lives of more than 100 workers and their families. So we really ask the members of this committee, and we ask you, Councilmember Hanif, to provide us with the support that we need to ensure that workers, day laborers, and low-income New Yorkers continue to have access to the services under this initiative. Thank you so much.
Thank you so much for your testimony. I'd like to now welcome Lihia Gualpa to testify. You may begin as soon as the sergeant cues you.
The time starts now.
Okay, got it. There it is. Well, good afternoon, Chairwoman Hanif. It's good to see you again. Thank you so much for the opportunity to testify on behalf of the Workers' Justice Project, which is a worker organization that represents across day laborers, delivery workers, and construction workers who are essential to the city's recovery. As you all know, without immigrant New Yorkers, there is no essential workforce in our city. And we're here, along with my colleagues, to urge City Council to demonstrate its commitment to protect, invest, and honor essential workers, particularly day laborers, construction workers, and delivery workers, by investing in key initiatives such as the Day Labor Workforce Initiative. But also we're asking for support for the Day Labor Worker Support Initiative, the Worker Cooperative, Business Development Initiative. These key initiatives are the safety net that immigrant essential workers have been relying as frontline workers, not only during COVID, but also during climate change disasters. And they have been relying on these key initiatives to make not only possible New York City's recovery, but also to have safer jobs, living wage jobs, as it was mentioned by Veronica, my colleague. These initiatives have at WJP have trained close to 1,500 workers in construction, specifically in site safety training. We connect every year more than 1,000 living wage jobs to workers from Brooklyn and across the city. We have connected more than 4,000 workers to critical services, make sure they can access to healthcare, legal services, and other critical services that they were needed in order to recover from the pandemic. And we're here again just to say, we're counting on your support to make sure that the city continues to invest in these key initiatives and that these are considering your budget priorities. And we look forward to working with you. Thank you.
Thank you so much for your testimony. I'd like to now welcome Nadia Marian Molina to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Thank you. Thank you to the Committee on Immigration, and thank you to Chair Hanif for the opportunity to testify today. My name is Nadia Marin Molina. I'm the co-executive director of Endilon, the National Day Labor Organizing Network. And my testimony today is in support of the request of the New York City Day Labor Workforce Initiative and its renewed funding for $5.4 million to allow them to strengthen their work, include new programs, and expand their training capacity and build the power of immigrant and low-income workers in New York City. We'll provide more background on Endilon and day laborers in our written testimony, but I wanted to highlight a few key facts for the committee about day laborers and centers in New York. New York City has an estimated 75 to 100 day labor corners or paradas, and the day labor centers are reaching those workers on those corners, many of them immigrants who would otherwise be left out or left behind. New York City has one of the only female day labor corners in the country, which means organized women on a day labor corner, and the Workers' Justice Project. Ligia could speak more to that work as well. Day labor centers function as both alternative workforce development institutions and an important form of grassroots enforcement of workers' rights and improving wages. 50% of workers nationwide on corners report that employers have stolen their wages in the past 2 years, and at day labor centers, that's reduced to a small percentage who pay less than agreed. A study in Seattle showed that an organized center is able to raise workers' wages, both of workers in the centers and of workers out on the street corners. In addition to the core work of the initiative, which has been mentioned, I would add that the day labor organizations have supported the implementation of the Excluded Worker Fund, $2.1 billion, COVID implementation and cash assistance, and construction site safety training under local law 196. The city needs to do more to protect workers, and the recent death of construction worker Angel Vilataxi in Brooklyn, fall from heights are preventable, and the Day Labor Workforce Initiative works on that. We're proud to be able to support our member organizations, and we ask that the City Council continue the expansion and development of the Day Labor Workforce Initiative. Thank you.
Thank you so much for your testimony. I'd like to now welcome Gail Johnson to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good evening, Chairperson Shana Hanif, distinguished members on the Immigration Council. My name is Gail Johnson, and I'm a worker at Hopewell Care Child Care Cooperative, a member of the Carroll Garden Association, and I'm here on behalf of 13 organizations which make up the Worker Cooperative Business Development Initiative, WCBDI. Our cooperative is made up of immigrant women, Black and Indigenous women of color from the Caribbean, Latin America, and Nepal, speaking 4 languages. Our members speak French Creole, Bengali, Spanish, and of course, English. We are founded in 2017, creating employment for our members who support families here and abroad. As immigrant women, we support many New York City coalitions who are fighting for housing, budget justice, climate change, language justice, immigrant justice, ICE removal, social justice, coverage for all, public bank, just to name a few. It's a lot, just to name a few. We also provide much needed service to a community across the whole of New York City in childcare. We are grateful here to get those assistance from WCBDI, who also provide legal support from Taproot Justice, as well as training on technology, industry training, health and safety, childcare, and other coalition partners. Carroll Garden Association has been our incubator and continues to support us in our daily needs. Childcare is not a socially distanced service as a result of the pandemic. Our cooperative or immigrant community especially has experienced a lot of challenges in our industry, including housing insecurities, income challenges, accessibility, and immigrant restriction. We work in solidarity with other allied organizations like National Domestic Workers Alliance, hand in hand, to foster better working conditions for our members. We believe the city can continue to support us through grants and loans and help lead immigrant cooperative in need. It is also for this reason that we also support the creation of a public bank so that the city can invest public dollars back into the communities and small businesses. Finally, we hope that the city will support education and technical assistance for community land trust and coverage for all immigrant workers. Thank you so much for listening.
Thank you so much for your testimony. I'd like to now welcome Plinio More Duran to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Okay, I'm not seeing them on the call any longer, so we'll move on to the next panelist. Estefania Galvez, you may begin as soon as the sergeant cues you.
Your time start now.
Hello, everyone. My name is Estefania Galvez, and I am the Director of Workforce Development at New Immigrant Community Empowerment. NICE. We're grateful to share our testimony today on behalf of our organization and the millions of immigrants that live in this city and the day laborers and families in New York City. We really have to urge City Council to invest in the Day Labor Workforce Initiative, the low wage support, the low wage worker support, and the construction site safety training, so that we can continue the work that organizations like ours provide for over 15,000 immigrants per year. Day laborers, especially newly arrived immigrants and women, work in some of the most unsafe and unregulated industries. They experience rampant wage theft, pervasive construction accidents, unchecked workplace hazards, and lack of access to free in Spanish and culturally dignified training. This is particularly true for elder workers and women who are transitioning from domestic work to construction work, and vice versa. On day labor corners, Las Paradas, day laborers also lack access to shelters, water, bathrooms, and basic necessities. The goal of the DLWI is to work together with NICE and other job centers and address these issues by connecting workers to critical services, providing training on safety and legal rights, leading wage theft clinics, facilitating access to good jobs, and most importantly, creating safe and dignified places for all the day laborers looking for a job. The services we provide at NICE are more essential now than ever. Every year, over 7,500 workers use NICE during the mornings to get jobs. And in the last year, we have dispatched over 1,200 jobs across over 100 different types of jobs. Only in the last 2 years, our membership has increased to up to 12,000 members because of the pandemic. Day laborers who secure work through center like ours, like compañeras have said it before,
I'm expired.
Wage theft. We urge the council to renew and expand the Day Labor Workforce Initiative Coalition budget for the fiscal year 23 to $5.4 million to increase the access to workforce development and training opportunities for immigrants, for day labor centers and low-income New Yorkers. We also urge the council to renew and expand the site safety training funding under the local law 196. It is more important than ever that New York City protects immigrants and that we do everything that we can to help them get the services that they need and they deserve. Thank you so much for your time.
Thank you so much for your testimony. I'd like to now welcome Diana Moreno to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
I will be the person doing the testimony for New Immigrant Community Empowerment. So Diana, who is our interim ED, sends her hellos, and let's keep up the fight and get everyone to speak their voices.
Thank you so much. I'd like to now welcome Yesenia Mata to testify. You may begin as soon as the sergeant cues you.
Time starts now.
My name is Yesenia Mata. I am the executive director of La Colmena, a day labor and immigrant rights organization based in Staten Island and form part of the Day Labor Coalition. I want to thank Chairwoman Hanif and the rest of the committee members for holding this important hearing. Due to the time frame, I won't be able to highlight all of the work that we have done, but I do want to emphasize that our work saved lives during the pandemic. We provided Staten Islanders with food, COVID vaccines, PPE, and were part of the Moya cash distribution. La Colmena was the only center on Staten Island that was open since the beginning of the pandemic. We never closed our doors, because day labor centers are among the first to respond to emergencies. We were the first during Hurricane Sandy, and we were among the first to respond to the pandemic. And this is exactly what the Day Labor Coalition has done. But now it seems as if the coalition's work is being forgotten. I say this because I'm here today to share with you what is presently happening with our city contracts. For example, La Colmena's contracts are still pending to be registered, despite us submitting all of the necessary paperwork. La Colmena, along with my colleagues here today, are wondering if we will get reimbursed. La Colmena has accrued over $500,000 to date, and we have yet to be able to invoice for work provided. Given the present circumstances, we have had to cut down some of our programming, and we don't know how long we can keep our doors open. We have been able to keep our center running in the meantime, thanks to our supporters. At La Colmena, and as the Day Labor Coalition, we just want to continue supporting the immigrant worker. And I do have faith that you will look into this and continue funding us, because I have seen the work that you all have done. We are here to work with the City Council to push not just for La Colmena city contracts to be registered, but for other organizations as well that are going through this. An open and equitable New York City should not leave behind those organizations like ours that were literally on the front lines of the war against COVID. I repeat, we cannot forget about essential immigrant workers. Thank you for your time.
Thank you so much for your testimony. I'd like to now welcome Magdalena Barbosa to testify. You may begin as soon as the sergeant cues you.
Time starts.
My name is Alice Davis, and I am a supervising attorney at Catholic Migration Services. I'm presenting this testimony on behalf of our Director of Legal Services, Magdalena Barbosa. Catholic Migration Services is a nonprofit legal services organization with offices in downtown Brooklyn and Queens. We represent immigrants in all 5 boroughs. I am specifically submitting this testimony on behalf of the Citywide Immigrant Legal Empowerment Collaborative, otherwise known as CILEC. And this is in support of the renewal of the Low-Wage Worker Initiative funding. This is the only funding from the city that's specifically dedicated to employment-related legal services to assist low-wage and immigrant workers. And we're also submitting this in support of the low-wage workers support for community outreach and community organizing from our partner organizations. Catholic Migration Services is part of CILEC, which is a collaborative of several legal services organizations that provides, and community-based organizations to provide quality legal services, community outreach, and case management for low-income immigrant workers. Since fiscal year 2019, the budget has included $2 million for the Low-Wage Worker Initiative and an additional $500,000 for the low-wage worker support. We are strongly urging the City Council to continue to demonstrate its commitment to New York City's most vulnerable workers, including undocumented immigrants who work in some of the most dangerous and low-paying jobs in the city. At the outset of the pandemic 2 years ago, SILIC represented over 1,660 low-wage workers in legal actions and have obtained over $9 million in settlements and judgments. This is particularly relevant for many of the workers who were excluded from unemployment insurance, who were able to have a safety net during a very precarious economic time. Groups like Catholic Migration Services have provided support to workers in not just receiving pandemic-related emergent legal services needs, such as paid sick leave and access to the Excluded Workers Fund, but also helping them identify previous wage theft violations and assisted them in collecting money for those violations. Catholic Migration Services and the SILIC Consortium urge the Council to demonstrate its commitment to these workers by ensuring the renewal of the Low-Wage Worker Initiative and the Low-Wage Worker Support. Thank you.
Thank you so much for your testimony. I'd like to now welcome Alba Lucera Villa to testify. You may begin as soon as the sergeant cues you.
Time starts.
Hello, good evening. Thank you, Chair Hanif and the rest of the members of the City Council for listening to our testimony. My name is Alba Lucero Villa. I am the Executive Director of the Coalition for Immigrant Freedom, also known as Northern Manhattan Coalition for Immigrant Rights. This year, the coalition is celebrating its 40th year. And after 40 years, the organization has been serving thousands of New Yorkers every year. As a highlighted, respected cornerstone of the community, we provide exceptional legal services, adult literacy programming, and worker-centered services to New Yorkers. Most of the individuals who we serve are low-income New Yorkers hailing from the Caribbean, Latin America, Africa, and the Middle East. Some come from generations of New Yorkers. Many have lived here for decades, and others are recent immigrants. Regardless of whether they're LPRs, US citizens, refugees, asylees, or have yet attained status, they are New Yorkers. Many, however, do not feel they can access traditional avenues for help due to lack of language access, fear, or many other barriers. Organization is often the first place they come to ask for help, be it for legal assistance or for basic social services, and we take that very seriously by making sure that we follow a holistic delivery of service model, like my partner organizations that have testified before me. And what this means in practice is that we look beyond just the initial legal matter that brought someone in, or the unemployment that's brought someone in, and we try to complement that with the legal services we offer, in addition to the workforce development, adult literacy and civics education, mental health screenings, and direct job placements. We can do this in large part because of City Council funding for adult literacy, construction site safety, DOVE, and the Day Labor Workforce Initiative. Under the latter, we opened the Manhattan's only worker center, a fully operating center with space for workers to meet, a hiring hall, a cadre of organizers, teachers, and lawyers who are all committed to dispatching and training workers, fighting wage theft and abuse, and building our local economy.
Time.
In this FY21, we served 1,500 workers, surpassing all deliverables, meeting all trainer goals, and we dispatched this year already 599 workers with months remaining. We did this despite reimbursement delay and delays in contract registration, which we have been still paid for some deliverables from last year. As we know, the COVID-19 pandemic exposed many systemic failures and highlighted the disparity in communities of colors, and we met those challenges along with the worker centers previously testified. I really urge City Council to allow us to continue being a lifeline to our community and acknowledge that community-based organizations are a key partner in the idea of building back better. So we need more resources, not less, to be able to serve our communities and all the communities of colors in New York. Thank you.
Thank you so much for your testimony. I'm going to now turn it to Chair Hanif for any questions or comments.
Thank you so much, and thank you all for testifying this evening, and big thanks to Yesenia for just naming the egregious issues around the city's contracting process. I'll absolutely be looking into this, and we'll be doing a follow-up just to learn a little bit more about what's been going on. I absolutely empathize and understand that you all have been lifelines to our communities. I want to dig a little deeper into just the plight and conditions of women workers, women day laborers, and women domestic workers. Gail, really good to see you here. Please extend my love to Ben. Carroll Gardens Association is in the 39th, and really love the work that you all have been doing to organize domestic workers on the advocacy level and on the ground in Carroll Gardens and Cobble Hill. So thank you, really good to see you. I saw Lihia's hand go up. Lihia, if you could just start us off. Could we unmute?
Yeah.
Great, there you go. Thank
Yeah,
you.
I was just gonna say, I mean, I just wanted to remind New York City actually is the home of also women day laborers. WJP actually is center. We actually run the first women day labor hiring hall in the city that is actually run in out of Brooklyn, near the only women day labor corner in the country. The reality is that women, especially those that are working in domestic work, also construction, have been struggling not only with low paid jobs, unsafe working conditions, but actually are struggling the hardest because they're not just workers, but they're mothers. They had to become teachers. So one of the biggest struggles has been job stability and how to have job flexibility. And most workers, especially women day laborers, have been relying on day labor centers like ours because of not only because they're able to access better wages, because the ability to get more job flexibility. And a lot of day labor work that they do offers that the ability to have that job flexibility so they can take care of the kids. Now that their kids are transitioning into are moving back to schools, they still need to be able to figure out how they're able to take care of their families. Discrimination is one of the biggest issues as they enter in the construction industry. We're so glad to actually get the first contract of Cleanup Corps that will put, at least for WJP, and I know for La Colmena and many others, a great cohort of women into industries, in male-dominated industries like construction. And for WJPs also, and more women entering even into delivery work, making these jobs not only safe jobs, better paid jobs, but also jobs that women can able to access in a more dignified way.
Thank you. If we could unmute. Okay, I see Alba is unmuted. Go ahead.
Yes, I wanted to share a little bit about a screening that we implemented because we saw such a need, such a mental health need in the workers we were serving and the clients we were serving. We had some small funds from a foundation to put together a mental health screening, and had a part-time mental health coordinator who triaged that and then referred folks. And you know, in the first 2 months that we implemented it in the fall, the late fall, 214 clients were screened, mostly women. Out of those, 63 screened positive for either domestic violence or mental health related needs. And because of the one person we had, we were able to really properly refer to appropriate services. And now everyone that comes in through our doors gets that screening. We ran out of that small funding, you know, and fortunately last week got some DOVE money to be able to continue it. And so we're really trying to meet those needs. It's been rampant. I think in the past we used to survey our community members, and more than 50% had domestic violence or knew someone close to them that had, and that jumped to 75% during the pandemic. So the need is really out there. I know that right now our worker center has an influx of women. Our ability to offer English classes remotely has opened doors for women. I mean, I've been in touch with you know, the Office of Gender-Based Bias, because now in addition to the general, you know, wage theft, everything that we see, we're also seeing actual trafficking and, you know, need to pull in from all sorts of resources. So we've been partnering up with different city agencies. So, you know, I think that's something that we all can relate to, that we we may do one or two or a couple of things primarily, but we end up doing it all because you know that once that person is in your office telling you their stories, they may not go somewhere else. And so you really want to reel in that trust and deliver, because if you don't deliver and you don't connect them to the right resources, they're just going to feel like one more person failed them.
Thank you. Yesenia.
Yes, thank you again, Chairwoman Hanif, for allowing us the opportunity to advocate for our organizations. Well, as I indicated, even though we still have not been able to get reimbursed because none of our contracts are registered and it doesn't allow us to invoice, we still understand the duty that we have as day labor centers to the immigrant worker. We still have started the initiative Cleanup Corps, and as Ligia mentioned, this initiative also allows women to partake in a male leading sector. For example, in the Cleanup Corps through La Colmena, majority of the participants are women. There's 34 participants, and more than, I would like to say, 2/3 are women. If you actually look at our Twitter, you will see how all of them are always cheering on and cleaning up the parks. And it's beautiful. It's a beautiful initiative. And this is the reason how, despite we're not getting reimbursed or are able to invoice, we understand the duty that we have to the immigrant worker, and this includes women. And if you really look at the initiative, is actually woman-led. We have EDs in this area that was predominantly led by men, and now it's being led by women. And through the Cleanup Corps, but as well through our centers, you are able to see that there are many women who are now going to our centers because they also see women leading in these positions that are predominantly led by males. And this is why I really appreciate you giving us this opportunity to advocate, because we want to continue having our centers open because we know the opportunities that it provides to the immigrant worker, including women.
Thank you so much. And I absolutely see it in this panel. It's been powerful to see you all lead in these organizations, in these positions and advocating. I mean, the city is one that must be feminist. And as we work towards more dignified positions for women in the sectors of domestic work and construction work, it is just absolutely essential that women lead the work. So thank you just for your work, and would really love an opportunity to meet the workers as a follow-up, particularly women workers as a follow-up, and we can organize that soon. Could we hear from Estefania and then Veronica?
Well, I have the perfect opportunity to come for you to come see women. On the 25th, we are graduating our 3rd class of women in apprenticeship from NICE that we have used this money we don't have to create, right? Because that's the ongoing theme. We have tried this very successful program we're building that has to do with sisterhood, elevating women, creating spaces just for women. Also, it being in construction, them having training and at the same time having hands-on practice. And the practice has been supporting the communities that were affected by the hurricane last year. So we have gone full circle. We are giving stipends and we're giving education to undocumented women that are recently arrived in the country. And they are getting to learn and do the job while they're helping their communities that are the most affected in New York City. And so that is the vision. The vision is that women, like we have the power to all of the things, like we deserve all of the things already, right? Like we know how to do it. As someone that was a construction worker as a stagehand, and the first day at work, someone was like, why don't you go look for that tool in your purse? You know, I cannot imagine what other people, specifically that probably have even more difficulty with their language barriers can go through. And so I do think that, as you said it, and I see it with all of las compañeras y las hermanas acá, the thing is not a matter of like we don't know what to do or how to do it. It's a matter of like, we need the funding to be able to do it. And we need this administration to see the importance of that. And so, yeah, the relationship is women are being beat up, evicted from their homes, taken away from their children. And at the same time, they have to go pay $800 to be able to become a caregiver. But they don't know if the person that they're paying the $800 to be a caregiver is actually the right person that they can do that from. And vice versa with all of other types of safety precautions that are so important, because the safety courses are just good for them to stay safe with themselves, their communities, and the workplace. So it all really comes together. And I invite all of you to come. Today was our first day of our third cohort. We will be in Elmhurst tomorrow, and next Friday we will be having our graduation. And we welcome all of you to come next Friday to NICE if you'd love to come.
Thank you for that. Veronica?
I just wanted to say, Council Member Hanif, that the work that the day labor centers are doing, this is our 7th year. We're asking for funding on the 7th year of our initiative. And as you can see, this is a women-led initiative where we are transforming the lives of not only day laborers, but really women who have been at the forefront of this pandemic, who have been elevating New York City, who are at the core of what the work that we do, which is provide opportunities for day laborers and low-income workers to really learn skills and do it in a way that is safe and that it provides them the flexibility that they need to really work and at the same time manage their families. You have a lot of women who need childcare, who need the resources to sustain their families, who are single mothers. And these are the populations that we serve. So we really want to invite you to come and visit our centers to see the diversity that exists within each one of the centers. We have 11 day labor centers currently operating, and we continue to expand. And this year is more important than ever because it means that we're strengthening the growth of our organizations. And we continue to do the work and the opportunity to carry on through cleanup corps and all the initiatives that support the work that we do. So we want to thank you. Thank you so much for this space.
Thank you. No, thank you, Veronica, for lifting that up so powerfully. I'd like to now just call on Gail, who I know would like to read on behalf of another colleague. Before you go, I just wanted to just affirm my own commitments to public banking and community land trusts and coverage for all. So thank you for including that in your testimony.
Thank you so much, Chair Heffron. And thank you so much for this opportunity. So this testimony is from Ruth Lopez. She's a worker owner of a cooperative called Palante Green Cleaners. I'm reading her statement. We offer cleaning service to offices, apartments, houses, and we do cleaning on post-construction. We were created in 2014 as a solution to lack of job in the city, with living wages that will allow us to survive in the city and to help our families in our communities, in our countries. Like my cooperative, there's a number of cooperatives in New York City with different economic activities for cleaning, support for elderly, childcare, dog care, and a lot more service that help the economic growth of the city. The cooperatives has been able to improve the lives of many immigrants and improve unemployment rates in the city. However, the pandemic, as with a large number of small businesses, wreaked havoc on most of the cooperatives. Some failed to survive and closed their doors. Others, mine, are suffering the economic consequences of the pandemic. That is why today I want to tell you that we need your support. We need you to put your eyes on this type of business that undoubtedly help the prosperity of all. I believe that the future of the economy could be cooperative to achieve a better world with equality, justice, and fair economic growth for the hardworking owners of the cooperative and for the economic growth in the city of New York. If my cooperative grow, if you support us, we will have many more immigrants who can join these businesses. We'll have a happier and more committed workforce,
Time
giving
expired.
New York City a leg up in the economic growth. Your support, your commitment to the cooperative is necessary and urgent to continue the growth and not to be just another number in the statistic of small business that disappears as a result of the pandemic due to lack of support. I'm confident that we can count on you. Thank you. And thank you for that opportunity to read for Ruth. And I will deliver your message to Ben. Thank you so much for all that you have done, Congresswoman. And we appreciate you greatly. Thanks.
Thank you. No more questions for this panel, Bonnie. We can move on.
Thank you, Chair, and thank you to this panel for all your testimony. We'll now be moving on to our final public panel. Thank you again, everyone, for your patience. In order, I'll be calling on Zara Nasir, followed by Dania Darwish, followed by Dimitri Daniel Glinsky, followed by Alexi Shalom, followed by Yasmin Hassan. Zara Nasir, you may begin your testimony as soon as the sergeant cues you.
Your time starts now.
Hi, good afternoon, Chair Hanif. Good to see you. Wishing you a good recovery. My name is Zara Nasser. I use she, they pronouns. I'm here for the New York City Anti-Violence Project, where I'm a deputy director. And we appreciate the council's past support of our work with immigrant, LGBTQ, and HIV-affected survivors of violence. During times of crisis, political and economic instability, and many forms of violence increase, right now AVP's work is more important than ever. AVP is the only LGBTQ-specific victim services agency in the city. We operate a English-Spanish bilingual 24/7 hotline and provide legal services, counseling, community organizing, and advocacy. All of our services are free and confidential and currently offered in a remote and in-person hybrid. We work with community members who are also among the most marginalized and vulnerable in the city and who have become more so during the pandemic, including LGBTQ and HIV-affected immigrant survivors of violence who are facing economic and housing insecurity, the devastation of the pandemic, and in some communities, increased threats of hate violence and other forms of violence. Currently, we have 122 open immigration cases that include full representation for U non-immigrant status, U visa, VAWA self-petition, asylum, work authorization, and adjustment of status for immigrant clients. In addition to these matters, we also provide holistic legal care for multiple needs that may arise. This includes legal name change, advocating for their behalf in criminal court when they are complaining against a witness involved in intimate partner violence or hate violence, petitioning for family court, order of protection, housing and tenant issues, public benefits, employment discrimination, and
Time
more.
expired.
To continue and better support survivors of violence, AVP is seeking a restoration of funding for the Council Initiative for Immigrant Survivors of Domestic Violence and the Legal Services for the Working Poor Initiative. We appreciate past support and look forward to working with you. Thank you.
Thank you so much for your testimony. I'd like to now welcome Dania Darwish to testify. You may begin as soon as the sergeant cues you.
Your time starts now.
Thank you, Chair Hanif, and to the committee. My name is Dania Darwish. I am the Executive Director of the ASIA Women's Center. The ASIA Women's Center is a survivor-led gender justice advocacy organization that shelters survivors of color, particularly from the AMEMSA and Black, Indigenous people of color population. I want to talk today about domestic violence and immigrants. There is absolutely no pleasant way to say this, but domestic violence survivors are falling through the cracks across the board in the city. Many shelters across the city are asking survivors for IDs, and that terrifies domestic violence survivors that are undocumented, and they are worried that the city will report them to ICE. Whether that is or is not true, undocumented folks cannot access several types of community of food stamps, and other essential services that would help them become independent of an abuser. Last night, I picked up a survivor from a major hospital. Major hospitals, by the way, report domestic violence cases to us, and so does Safe Horizons, so do family justice centers. They are places that call us when there is no other type of service to take them in. And I picked up a woman that was beaten by 5 family members, undocumented, could not call on anyone else for help. Her ex had threatened to put her in jail because she was undocumented. And on Valentine's Day alone, we had 47 cases, 5 of them being from major hospitals that called us. Post-COVID, we're looking at an increase of 3 times. The amount of clients that we have had lately is startling, and it is beyond our capacity, and that is why we are in dire need of city council funding to continue with being able to handle the capacity that is critical to the wellness of survivors of domestic violence. And that is why the ASSIA Women's Center is seeking city council funding to continue mental health and shelter programming for domestic violence survivors. And we're requesting a total of $600,000. Thank you so much.
Thank you so much for your testimony. I'd like to now welcome Dimitri Daniel Glinsky to testify. You may begin as soon as the sergeant cues you.
The time starts now.
Thank you, Chair Hanif, for this opportunity to address such an informative hearing. I am Dmitry Glinsky, leading the Russian-speaking Community Council, founded in 2011 by and for our immigrants, especially exiles from dictatorships and refugees from conflict areas. We were the first to bring Ukrainian and Russian Americans together for anti-hate dialogue and collaboration on advocacy in response to the first invasion of Ukraine 8 years before the current one. For decades, we have provided educational events, advocacy from New York to DC through our nationwide project, organizing translations into Russian and Ukrainian, at times other services, almost all of it pro bono. We haven't had city funding after a few discretionary contracts for which we stopped applying for lack of operating support to manage them and to grow. This funding disadvantage is shared by Russian and Ukrainian immigrant-led CBOs. Just for example, the Council Discretionary Award Tracker will show you just 1 Ukrainian and 1 Russian group cleared for these grants every year, each for about $5,000 only. So my message is not about specific budget items, but a call to acknowledge and begin addressing systemic issue. Refugees and exiles from entire region ravaged by dictatorships and war, whose own institutions have no public funding to employ their community professionals and are run by full-time volunteers, while the oligarchs from whom they fled have wielded influence here in New York, affecting community services through private sector lobbying, dark campaign money, some large philanthropies where they have laundered their funds and reputations, and even in local government where their business partners have held jobs. I'd like to commend our mayor and commissioner for their early advocacy for Ukrainians. I urge them to provide in the range of $1.5 million for services to the Ukrainians eligible for TPS and the refugees that will be coming. We urge Moya and others to advocate for a substantial increase of the regional refugee quota and for relief for the growing number of Russian and Belarusian dissenters fleeing from persecution. All of them are in great need for more language access, but much more so for cultural competency that our government would gain by hiring more professionals from these backgrounds. We ask each of you to help our government and philanthropy start engaging with the unprivileged in our community and their own agencies to address these issues. Thank you for your attention.
Thank you so much for your testimony. I'd like to now welcome Alexei Shalom to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good afternoon or good evening. My name is Alexei Shalom, and I'm a representative of United Auto Workers, Local 2325. UAW Local 2325 is a labor union representing almost 3,000 advocates in New York City who fight every day to make New York City a more just place. We are proud to represent the employees of many of the service providers testifying here today who carry out the programs and initiatives being discussed. Among our members are the staff of New Immigrant Community Empowerment, NICE, who provide support, services, and organizing resources to day laborers and recently arrived immigrants in New York City. Throughout the pandemic, our members at NICE have been at the front lines in delivering relief and support to the most affected communities in our city. UAW Local 2325 urges the council to invest in the Day Laborer Workforce Initiative, construction site safety training, low-wage worker support, adult literacy initiative, and NYC Care to continue the work that organizations like NICE provide to over 10,000 immigrant workers per year. Our members are extremely proud of the work that they do and thankful to the council for giving them the opportunity to serve the people through these crucial programs. Day laborers and recently arrived immigrants work in some of the most dangerous and precarious industries. Most of these workers experience wage theft, suffer accidents in the workplace, labor exploitation, discrimination, and threats and lack of access. The goal of the DLWI is to work together with NICE and address these issues by connecting workers to critical services, providing training on safety and legal rights, and dignified spaces for day laborers looking for a job. The services our members provide at the NICE Center for Workers are more essential now than ever before. Last year, the NICE Center for Workers referred approximately 1,500 people to critical services, including health clinics, legal aid, and financial services. Crucially, NICE also offered these services in Spanish and in a space where their members feel safe and empowered. Our union strongly urges the council to invest in and expand the DLWI and the other initiatives mentioned. Thank you so much.
Thank you so much for your testimony. And I'd like to now welcome Yasmin Hassan to testify. You may begin as soon as the sergeant cues you.
Time starts now.
Good evening, everyone. My name is Yasmin Hassan. I also go by Yassine Hassan. I'm an immigration case manager working at the Yemeni American Merchants Association, also known as YAMA. YAMA is a grassroots nonprofit social services organization founded in 2017. Our mission is to educate and elevate Yemeni American merchants and their families through education, civil rights advocacy, business, social services support, and immigration support. Based in Bay Ridge, Brooklyn, New York, we seek to advocate advanced policies that support New York City's estimated 6,000 Yemeni American bodega owners and their families. We are here today as an organization serving Yemeni American immigrants to speak on the lack of funding for immigration services, not only for YAMA, but all across New York City. The work that YAMA's immigration program currently does entails citizenship applications, green card, TPS, DACA, immediate family and spouse petitions, travel documents, work permits, and advocacy work with congressional and city council representatives. Now more than ever, YAMA needs to see additional funding allocated all across the board to orgs that aid in deportation proceedings, for advocacy efforts for delayed cases with extreme life or death hardships, as well as for interpreters that speak a wide range of Arabic dialects, namely the Yemeni dialect. Sadly, many organizations currently do not have the capacity to advocate on deportation cases. We'd like to see more funding provided to the New York Immigrant Family Unit Project to ensure more clients can be serviced needing emergency representation upon receiving an NTA. It can be heartbreaking not finding enough organizations to refer clients out to. The Cultural Immigration Initiative has been very successful with large organizations offering cultural programming that have the capacity to complete the difficult DCLA application and contract requirements. We ask that the city simplify the DCLA contracting procedures to allow more organizations to benefit. YAMA urges the committee to continue to keep small organizations like ours in mind. YAMA represents a community that is often underrepresented. Thank you again, and thank you to all that attended the meeting, the committee hearing today, and I heard what YAMA had to say.
Thank you so much for your testimony. I'm going to turn it to Chair Hanif for any questions or comments.
Thank you all so much. I'm really glad to see my friend Danya Darwish, one of the first, or if not the first resident at ASIA was from the 39th district. And I remember when ASIA had just cut their ribbons and weren't fully prepared to take in anybody. And I had been scrambling to figure out how to provide housing at a very late hour of the night and seeking refuge for a very young Muslim immigrant woman who was in a forced marriage. And so the work that Danya has done has really helped shape and elevate the needs of Muslim women in particular, and Muslim immigrant women in particular, young Muslim undocumented women. And so I'd love, Danya, for you to just expand on
how it's been providing refuge and safety to undocumented women, and if you could speak to the sort of age bracket of survivors who are undocumented, and how else ASIA has built in services to accommodate to undocumented survivors.
Absolutely. Councilmember, it's been so nice to be on this panel with you. I've seen you do community-based work, and to see you do community-based work from coming from that point to now being a city council member, I'm so incredibly proud of you and honored to be on this panel with you today. The client that we had just yesterday, we picked her up from a major hospital. I picked her up myself. I'm still the executive director, and I'm balancing between budgets and making sure that clients are okay, but we don't have a social worker on staff that I can pay yet at night to do the work where they can pick up a hospital worker themselves. And I cannot reasonably be okay with knowing that there's someone who's undocumented, who's an immigrant in our city, who's been beaten by 5 different family members and is now in the emergency department. Knowing that that exists, I cannot reasonably be able to sleep at night from this. So I'm the one doing that. And so this is why city council funding is so critical for us, because personally, I'm incredibly burnt out from this work. The client that we picked up that's undocumented, she will now be able to access food. She's not eligible for food stamps, but we have a full food pantry here at the ASIA Women's Center. She came with, just the clothes on her back that were very dirty and that her husband did not let her go into a laundromat and clean herself. So we were able to give her clothing. We helped her obtain an order of protection against him and the entire family. We got her connected to a therapist. We have volunteers who volunteer as like a buddy system, who become their friends. And we have this job referral program. As you know, a lot of undocumented folks cannot, they don't have a social security card number, and they don't have a way to make money on the books. So we have a extensive job referral network program where we've reached out to many businesses that will pay undocumented workers off the books. And so she will have a few interviews lined up by next week. But, as I said, on Valentine's Day alone, 47 clients came to us, on the day of love where people are supposed to be celebrating love. 47 clients came to us, 5 from major hospitals, emergency departments across the city, and from places like Safe Horizons, and from places like the Family Justice Center, referring clients to us. With regards to the age that we seek, the ages that we serve, we have people that are not even born yet that we're serving at the ASIA Women's Center. We've, since I've opened up the shelter, I have been in the labor and delivery unit, and I've watched 5 different women give birth. One gave birth to twins. We've had women who are 75 walk in our shelter. I had this one client, she walked in and she thanked me. She was like, this is the first place I've been able to feel safe in years. And she started to call me mom, and so that, as a 29-year-old, was something that was just so humbling. And it's very clear that immigrant women are falling through the cracks. There's a lot of discourse and bureaucracy and, programs where, English language, this and that, but where's the shelter? Where's the place where undocumented women can go to in their time of need? And so this is what our center serves, and we need to expand our programming and services so that no woman is on our wait list, and that every woman has a place to go at her greatest time of need.
Thank you, Danya. And, just thanks for doing the work that is that cannot be solved with legislation alone, nor expansion in budgets in our communities, of leading the cultural revolution, the cultural torch to destigmatize the conversations around domestic violence. As someone who's been in the anti-DV world, it is up to us to be having these conversations with our communities. And so just thank you for the work that you're doing. And I really, really hope and encourage that you rest
when you can. Dimitri, I would love to connect with you as a follow-up. Thank you for your work. And especially at this time, would really love for this committee to work with you around supporting Ukrainian refugees in the city.
Thank you. Certainly what we're looking forward to. Let's connect, absolutely.
Appreciate it. No more questions for this panel.
Thank you, Chair. And I see that we have one final panelist present. So I'm going to welcome Manya Q to testify next. You may begin as soon as the sergeant cues you.
Time starts now.
Good evening. My name is Manya Q, Executive Vice President and Chief of Staff at the Academy of Political and Public Health Services, or AMPS. Thank you, Chair Hanif, for the opportunity to testify. AMPS is a not-for-profit healthcare organization in Sunset Park that works to bridge a health equity gap among communities of color by providing free clinical screenings and bilingual mental health therapy integrated with individualized health education and social services to immigrant populations in New York City, free of cost and regardless of their immigration status. We work primarily with undocumented immigrants who suffer high risk of chronic, infectious, and behavioral health issues due to lack of health insurance status, and particularly with the Latino and Asian communities in Sunset Park. During the pandemic, our work has become more important than ever, reaching over 400,000 people through our outreach and education efforts. Our community health workers offer interpretation in Spanish, Arabic, and 3 Chinese dialects to help community members navigate our healthcare and social assistance systems. And every month, we're holding in-language workshops and distributing thousands of pieces of literature to community members through our canvassing and weekly food distribution events and posting at over 700 businesses. Now we're fielding COVID-19 vaccine vans and visiting schools throughout the community to conduct COVID-19 vaccine education. Requests for assistance have tripled throughout the past 2 years. We have a waiting list of nearly 50 individuals seeking support for our free mental health services, which in part has been supported, but which we cannot meet by current funding levels because of the cost of hiring a therapist. And finally, we're also offering preventative health screenings on a regular basis, streamlined with social support. We would like to thank the City Council for supporting us with the Immigrant Mental Health Initiative in the past. And we would like to ask for continued and enhanced funding for the Immigrant Health Initiative, as well as for the newest initiative, AAPI Community Support Initiative, to help support our work in COVID-19 recovery and continued healthcare support for our communities. Cuts to funding during the pandemic have been detrimental, and while demand services have tripled, many of our staff are stretched thin. And what has been mental health stressor in the past has now been exacerbated, especially with our mental health communities, with our Asian communities, where there is a 339% spike in anti-Asian hate crimes. We have a waiting list of nearly 50 individuals for mental health services, which we cannot sustain, especially because of the lack of therapists who are willing to work at a part-time level with not-for-profit organizations where our salary levels might not be able to be competitive enough for against other healthcare institutions that might be offering more. And currently, we're only able to sustain 2 mental health therapists on a part-time level in order to meet the growing need that we see. We are here for our communities, and we ask that you help to continue to make our work possible. And we really appreciate the support from the City Council over the past years and hope that we can continue to work together to offer on-the-ground culturally competent services during this challenging time. Thank you.
Thank you so much for your testimony. Chair, any questions?
Thank you, Manya. Could you share how many therapists would be the ideal number?
So ideally, we would like to see 2 full-time therapists, at the very least, at our organization. Right now, we are only able to offer part-time therapy due to the limited amount of funding that we have. And we're also working on coordinating a therapy fund program so that we can bring on board additional therapists while giving our community members an option to access other therapists outside of our network. However, this doesn't allow us to streamline our services as well. It also means that the therapists that we bring on board might not necessarily be consistent to offer a regular stream of services to continue our work in the community. So they likely will be temporary contractors until we can find more permanent staff to join our team. But the ideal for us would be to have a regular number of mental health therapists, particularly, again, full-time therapists who could be on staff. And ideally, if we could have 3 or 4 therapists, that would definitely be able to help us meet the demand.
And are the 2 part-timers right now bilingual in another language?
They are bilingual, yes.
And then how many, could you just share a little bit more about the demographics of who is receiving these services?
So we primarily serve community members in Sunset Park. Many of them are Spanish speaking and Chinese speaking. Currently, the therapists that we have on board are Mandarin speaking. So if we were able to bring on board another therapist that was also Mandarin and Cantonese speaking, that would be the most ideal. We have spoken with a number of other community organizations that have also struggled to find therapists. There simply is a shortage of therapists available who are willing to work at the nonprofit level. Many of them hold private practice, and especially for bilingual speakers, that's even more rare.
Yeah, I appreciate you for sharing that. I had a conversation earlier just on mental health within the Bangladeshi community, and particularly among Bangladeshi women, and a report was produced by SUPNA NYC. And one of the things that is a big concern as we call for more therapists and mental health service providers is just the need for our community to step into these professions and to even destigmatize the mental health sector as a career choice. Is there work that your organization is doing to lead on this kind of cultural destigmatization of mental health and creating a sort of pipeline to encourage first generation Mandarin speakers, Spanish speakers to pursue these careers?
So we have held mental health workshops where we talked about mental health as a wellness concept, as opposed to something that we should be stigmatizing. We're also really trying to integrate mental health conversations into a number of our other programs, including our health screening programs, as well as our ESL classes and other types of workshops. So perhaps it's not just about, say, a themed arts and crafts workshop that we might hold. We could also, we do also integrate mental concepts into some of these workshops. We've also worked with a local high school to hold a drumming percussion class or elective as a part of the high school curriculum. And through the drumming classes, while we don't really talk about while the curriculum is not about mental health, we do integrate mental health conversations in there, using drumming as a way for them to really think about how music plays a role in their own wellness and bring in that destigmatization and encourage them to seek help as necessary. The other thing that we're doing right now is a project with Target Merchant Theater in Sunset Park, where we're organizing a storytelling workshop between various different groups of Arabic, Spanish, Chinese, and English speakers, and giving them space facilitated through an artist facilitator and mental health therapist to share mental health challenges and their personal immigration experiences, and creating an audio piece or spoken word piece integrated with the theater's programming to be released in the summer, that would really allow the community to both stand in solidarity with what our communities have experienced over the past couple of years, but also to see that to understand, the mental health challenges the community has faced, and to really destigmatize what we think about as a mental health challenge.
Thank you for expanding on this, because I think it's so critical first acknowledge that within our communities, there have been Indigenous practices of therapy and our own forms of therapy that are beyond just talk therapy, which is so westernized. And so it is essential for us to be using art forms and other cultural projects to really look at mental health approaches as one that should be community oriented and community led, instead of only just a one-on-one with a practitioner or a specialist. So really, really glad to hear this from you, Manyak. No more questions for this panel. Thank you so much.
Thank you so much.
Thank you, Chair. At this time, we've concluded public testimony. If we had inadvertently missed anyone that would like to testify that has yet to be called, please use the Zoom raise hand function now, and we will call on you in the order in which you've raised your hands. I'll wait a brief moment. Okay, not seeing any hands, I'm going to turn it back to the chair for closing remarks.
Wait, I actually just have one more question for Manyak on mental health. Has there been an effort, Manyak, if you're still there? Okay, great.
I'm still here.
Awesome. Has there been enough effort to do like larger community-wide trainings for a peer-to-peer approach on how to be an upstander and to support de-escalation when we're seeing incidences occur within our own households, among parents and siblings and spouses? I think the peer-to-peer approach is just equally important within our communities. Would love to hear a little bit more about that if that's being offered.
Sure. So I'll actually talk about that in two different contexts. Number one, the DOHMH actually has a youth mental health first aid training program that they're launching citywide across the Tree communities. We're one of the organizations that are working on promoting this in the Sunset Park area, which is one of the Tree neighborhoods. So that would allow, allow youth in the neighborhood to be trained in these types of de-escalation strategies, and also provide and serve as ambassadors in their own community to train or to educate other youth. There is a similar program for adults as well. We were previously training. We were also previously a training site. Now we work with the DOHMH to also offer some of these adult mental health first aid workshops. On kind of the de-escalation, upstander, bystander intervention piece, there is also a piece of this that we're working with through our support from ZNT, through the Asian Community Support Grant, and in collaboration with organizations like the Asian American Federation and Nonviolent Peace Force. We're working on coordinating workshops for volunteers to become upstanders, but also for just community members to become upstanders and bystanders in the area.
That's really wonderful to hear. I'll be following up and would love to be invited for when these events take place. Thank you. Thank you so much.
Absolutely.
Okay, that was the final question. So this has been an incredible day. I am just really inspired and encouraged by the work that you all are doing. Thank you, thank you, thank you for your radical care. It's care, and it's a deep love, and it's a deep sense of commitment and urgency to the city we love. So it just really, it really showed, and I appreciate your patience with me going through all the questions, and really, I'm just inspired and encouraged by the trajectory of the work in the city as we continue to ensure and hold the administration accountable to efficiently, equitably delivering to immigrants citywide, and not just delivering services and a budget and legislative priorities, but also joy. Our immigrant communities deserve joy at this time. And that's really the root of my work as council member and also as the chair of this committee. And so it was really really powerful to hear testimonies that included these moments of joy for our immigrant neighbors. And I encourage you in the upcoming hearings also, because I know how serious they are and how painful the stories of our neighbors are, that we uplift side by side the joyful moments and the celebrations that you all are building into your work. So thank you for that. And you know, I've learned so much, and this is a big has been a big learning curve for me as I step into this role. And just to learn more about the extensiveness of language access across organizations, to the ways in which we're providing mental health services and destigmatizing mental health, to all of the incredible ways we are providing legal services, the worker cooperatives led by women. Just so much is happening, and I really hope you take time to thank yourselves as we move in this fight, in this big fight for a just budget for our communities, a deserving investment in our communities. And lastly, I'll just say for the folks who testified today, all of the incredible people and fighters, I do hope you take time for community and self-care and rest. I hope you get to eat something. I know we've been on for a very long time. Thank you for making this such an incredible Monday. Thank you to the committee staff. Thank you to my team for a real incredibly powerful budget hearing. Thank you. And with that, I'm going to gavel out.